present.
Okay, good morning, everybody. Slight technical difficulty. Okay, good morning, everybody. The Board of Nursing now in session. I would just like to remind everyone that the hearing is being recorded. So if you are speaking, please speak directly into the microphone. If there are no objections, I will declare a flexible agenda, and we ask that everyone that is attending with us today please silence their cell phones. I'll begin by reading our mission statement. The mission of the Arkansas State Board of Nursing is to protect the public and act as their advocate by effectively regulating the practice of nursing. And with that, we are going to start with a little bit of business, and I believe Ms. Brandy has a program to present to us.
Action item I'm presenting due to the timeline of this request. There's grant monies involved for a school, so that is the reason why we needed to hear this before September. So we'll start with, this is ASU Mountain Home PN Practical Nursing Program. They would like to request an additional cohort for a high school practical nursing program from Leslie High School. This high school was previously managed by North Arkansas College, University of Arkansas, or NACUA. However, NACUA no longer wishes to operate the high school program. The high school cohort is required to meet the same admission requirements as the traditional ASU Mountain Home PN program. They will follow the same curriculum leading to 43 to 45 credit hours. However, the program will start in August instead of the original January that ASU Mountain Home PN program follows. It's a 12-month program, so they'll start in August and graduate the following summer of 27. 12 high school students have expressed interest in the program, and they are currently taking prerequisite courses this summer. They have met the ASU PN Mountain Home PN program admission criteria. ASU Mountain Home secured grant funding through the Arkansas Office of Skills Development to support the continuation of Leslie High School. The approved grant budget authorized the allocation of funds for the recruitment and employment of one full-time instructor and one adjunct instructor. Leslie High School identified a potential candidate for consideration who does meet ASBN educational standards. In addition, former ASU Mountain Home PN faculty members with prior didactic teaching experience have indicated their availability to provide part-time instructional support, which would assist in meeting the instructional coverage requirements for the fall term due to their proximity to the Mountain Home campus. That was a question I asked because most nursing programs are facing faculty shortages right now. So their response was they've already identified potential people to step in and fill that role. Also, to ensure, my next question was, what is your backup plan if that doesn't work? So to ensure adequate clinical instruction capacity, the program intends to offer compensation at a rate of $35 per hour for clinical adjunct positions. This rate is designed to enhance recruitment efforts and to facilitate collaboration with clinical site leadership in identifying qualified staff who may serve as clinical preceptors. Funding from the Arkansas OSD will pay for obstetrics mannequin, program textbooks, NCLEX PN review material, criminal background checks, student uniforms and clinical supplies, and all fees associated with NCLEX PN testing. 2 clinical affiliation agreements as of the end of June have authorized the placement of high school PN students within their facilities. One agreement provides students with access to long-term care and rehab services, while the second agreement provides hospital-based clinical environment. Additional clinical sites agreements are currently under review and remain pending. And the ASU Mountain Home Simulation Lab can also be used up to 50% of their clinical experience. These students will have access to the same support services offered through ASU Mountain Home as the traditional PN program, in addition to support offered through Leslie High School. The Arkansas OSD is covering all cost of tuition and fees to these students, so they have no out-of-pocket expenses. For supporting documentation, you have a letter of intent from NACUA to close the Leslie High School. They currently have 3 students still enrolled in that PN program from the Leslie campus. Those 3 will graduate. They graduated high school in May, and they were transitioned over to join the traditional cohort on the main campus at NAC in Harrison. So they're in their last semester of their program. They'll be graduating on July the 9th. Classes and clinical experiences were carried out as normally for the traditional students on the Harrison campus. So once these 3 students graduate July the 9th, NAC will no longer have students enrolled. So they are asking for closure of that program for ASU Mountain Home to be able to pick up the program. To give you a little bit of background history on ASU Mountain Home, their PN program was granted initial approval by the board in 1976, with the first class graduating in 1977. The last survey was conducted in 2025, where the board granted continual full approval. And the program has maintained full approval with ASBN since the initial approval date in 1976. So there are 2 actions for the board. First is to take action on the intent to close the program NAC. And then the second action is for ASU Mountain Home PN program to take up ownership of the program. I think we do have representation from both campuses. If you have any questions, they're with us on Zoom.
Board members, any questions? Comments? Okay, go ahead.
Good morning, ladies. All right, can y'all hear me? Dr. Camp, Ms. Manson, can you hear me?
Yes.
Hear you.
Good, good. So I'm the chairman of the education committee, and I got this email from Brandy, and I had a lot of questions, but she answered them all. She explained that here this morning of why the closure is happening. And you guys, Mountain Home taking ASU Mountain Home, which is great. It's great for these high school students. And I guess one of my questions here again was faculty. Faculty is hard, and she said that, that you have a plan and a backup plan to take these students on. Do we have that transportation from
The school district, sorry to interrupt, the school district has agreed to make transportation for them to come here for the fall campus.
Okay, are they falling in with your traditional LPN program? Or
They are not. Our traditional LPN starts in January, so this would be a unique ask for them to come to our campus, and we would be solely focused on them during the fall semester while they're here with us.
Okay, so they will not be going in with your traditional LPN program. You will start them out as their own cohort.
That's right. We would like to do that if we have future cohorts with them. Obviously, it would make sense for us to do those together. But this ask is for something unique so that we can meet their timeline since these are seniors.
That is unique. How many students are you currently going to enroll for this fall semester? Or do you have it?
There are 7
Okay,
senior students, and there's 1 student that graduated in the previous high school class that would meet criteria, so we might bring them on if they're able to meet the criteria for admissions.
great, great. Okay, I think that's all the questions I have. Does anybody have? Okay. Ms. Manson, would you like to make a comment?
No.
Okay, all right. Thank you, ladies. Okay, so with that, I have a motion before the board. I move that the Arkansas State Board of Nursing accept the letter of closure intent for North Arkansas College University of Arkansas Practical Nurse Program for the Leslie High School track and approve the addition of the Leslie High School Practical Nursing track for the Arkansas State University Mountain Home Practical Nursing Program. All those in favor? Opposed? Motion carries. Thank you, Cassie.
Do we have any additional? Thank you, Brandy, for that, and congratulations to you ladies. We're excited to keep up with you guys and the success of the program. Thanks for taking the time to join us. Okay, do we have any other board business to do right now? Okay, we'll go ahead and proceed with our first hearing.
I think they're here.
Is the respondent here?
They're here. Okay, they're here.
You can go ahead and welcome him in. Perfect. Good morning, everybody. I would just like to remind everybody that this hearing is being recorded, so please pull the microphone directly in front of you when you do speak, and please wait until you've been recognized to speak. We do ask that everyone that is joining us today, please silence your cell phones. And with that, I'm going to turn it over to Mr. Moulton, our hearing officer.
Thank you, Madam President. Good morning, board members. First item on your agenda, filed before the Arkansas State Board of Nursing in the matter of Margaret Virginia Russ Hampton, LPTN license number T 001714. As the president noted, my name is Charlie Moulton. I'll be acting as the hearing officer for this proceeding. It is a little past 8:45 the morning of Wednesday, July 8th, 2026. Doesn't seem possible that it's already July 8th, but it is. The hearing is being held in the offices of the State Board of Nursing located at 1123 South University, Suite 312, Little Rock, Arkansas. Mr. Dawson, would you be so kind as to identify yourself for the record, please? All right, thank you, sir. And you are Ms. Hampton, is that correct, ma'am?
Yes.
Would you be so kind as to pull that microphone down close to you so we could hear you better? All right. Would you be so kind as to say that again? You are Ms. Hampton, correct?
There I am.
All right. And you have read the order and notice of hearing, correct?
Yes, sir.
Okay. You're representing yourself this morning, correct?
Yes, sir.
And you're ready to proceed, is that right?
Yes, sir.
All right. Have you ever been in an administrative hearing before?
No, sir.
Okay. Let me explain to you what's going to happen, all right?
All right.
So Mr. Dawson represents staff. He bears the burden. He's going to go first. He's going to introduce whatever exhibits he's got that support the allegations of fact that are contained in the order and notice of hearing. He'll probably call some witnesses too. After he's done questioning those witnesses, I'm going to give you an opportunity to ask those witnesses questions as well, because you're representing yourself this morning.
Okay.
You don't have to if you don't want to, okay? But you do have the right to ask questions if you'd like. After he is done with his presentation, it'll be your turn. And then you can explain to the board why you think the allegations that are contained in here are correct or incorrect, okay?
Okay.
It's really important. You have a court reporter right next to you. She's transcribing everything. So if you have, because it seems like you already have a propensity to give a nod of the head or an uh-huh, I may stop you and tell you to give a verbal response.
All right.
I'm not trying to be mean. I'm just trying to get a good record for you, okay?
Yes, sir.
All right. You came in with some folks this morning. Are those witnesses or are those individuals there for moral support? Why are they here?
More support,
Moral support. They're not going to testify on your behalf?
not related
Okay.
to the situation.
Okay. All right. So once all the evidence is in, once you give your statement, this is a little different from what you see in TV. You can think of me as like a trial judge, but the board is actually the jury and they're the ones that make the decision. I don't make the decision. I just run the hearing for the benefit of the board, but it's for your benefit too, okay?
Yes, sir.
If at anytime you don't understand what's happening, you have a question, raise your hand, get my attention, and I'll get on the same page with you and explain to you what's going on, okay?
All right.
Do you have any questions for me moving forward?
Not right
Okay.
now.
All right. Do you understand how the process is going to work
Yes.
for the most part? Okay. All right, with that, Mr. Dawson, how many witnesses do you have?
Two.
Two? Let me go ahead and take judicial notice about the statutes as well as the rules that are governing this hearing. It looks like based on your sheet that you gave me, Mr. Dawson, it looks like what? 7 videos, is that correct? I mean, 7 exhibits, is that correct? And number 7 are videos?
Yes.
All right. You want to move the admission of exhibits 1 through 7?
Yes, I move that exhibits 1 through 7 be admitted.
All right. Ms. Hampton, I have to ask you, do you have an objection to the admission of staff's exhibits 1 through 7? Mr. Dawson, if you could, would you
Mhm.
help out Ms. Hampton? Ma'am, I'm going to ask you again, did you, and maybe you said it already, do you have an objection to the admission of any of these exhibits?
From the sheet here I just received.
Yeah,
No,
exactly.
no, sir.
All right, thank you, ma'am. Without objection, those exhibits are admitted. Ms. Hampton, did you bring any records or documents or anything you want the board to look at this
Yeah.
morning with you that's not already part of the record? Letters of recommendation, things of that nature.
I do, sir. I thought. Let me see.
What we're going to do is we're just going to go ahead and move forward. When the copies are made, we'll go ahead and stop. We'll let Mr. Dawson take a look at them, and then I'm going to see whether or not we could admit those, okay? Tell me
Yes,
what they
sir.
are. What are the copies that you're being made?
Okay, statements about, about the situation. of
Okay.
the night. And then, I answered the question to the, orders of hearing as
Okay,
well.
okay. Well, we will get to them when we get a chance, okay? As
Yes,
soon as
sir.
the copies are made, we'll address it. All right. Mr. Dawson, do you want to have an opening statement or you want to waive?
I'll waive that.
All right. Ms. Hampton, because he's waived his opening statement, I'm going to ask you to do the same thing. It's been my experience that your opening statement is going to echo exactly what you're going to tell the board anyway, so you just be telling them twice. Is that all right?
All right.
Okay. Mr. Dawson, you have both of your witnesses sitting there, is that correct?
Yes.
All right. Ms. Hampton, because this is a quasi judicial proceeding, I've got to swear all of you in. So all three of you, would you be so kind as to raise your right hands? Do you swear or affirm the testimony you're about to give in this hearing is going to be the truth, the whole truth, and nothing but the truth?
Yes.
Yes.
Thank you all very much. Mr. Dawson, how about your first witness, please?
Thank you. Good morning, board members. I call Carissa McVeigh.
Morning, Carissa McVeigh, Arkansas State Board of Nursing.
As part of your duties, do you manage and participate in investigations when complaints are made to the Board of Nursing?
Yes.
Would you please go through the respondent's license history?
This is Margaret Virginia Russ Hampton. She graduated from Arkansas State School of Psychiatric Technical Nursing in 1991. She's been issued Arkansas license LPTN T001714. It was issued by exam on September 8th, 1993, expires April 30th, 2027. She has no previous discipline on her license, no other license reported in nurses.
Did respondent request a hearing today to appeal the issuance of the letter of reprimand?
Yes, she did.
Okay. Did you produce a report outlining the issues involved with regard to the issuance of that letter of reprimand to be used in today's hearing?
I did not complete the report, but I did write the letter of reprimand.
Okay.
Mr. Dawson, I hate to interrupt you, but I think we've got Ms. Hampton's exhibits. They are circulating. Did you get a copy of them?
Rhonda. Rhonda. Oh, her bill report, yes.
We're still waiting on additional copies.
Just still waiting one extra copy. In the interim, if we could, Ms. Dawson, have you got a copy of those exhibits at this point? No?
No.
Okay. All right. I apologize. We'll just progress. Please proceed.
Okay. I realize you may have thought that I was referring to the investigation report submitted by investigator Rhonda Mayo. Did you also produce a short report for the hearing today?
Yes,
It's
sir. Yes, sir. I
Dated
did.
May 13th, 2026.
Yes.
I think that's previously into evidence as exhibit number 5. So do you have a copy of that report?
Yes, sir.
Casey? All right. If you would read through the narrative on the report, just so the board will know what the issues were in the letter of reprimand and what violations of the Nurse Practice Act that the LOR mentioned.
Starting on page 2.
On page 1, actually, the bottom
Okay.
page 1, yeah.
The Arkansas State Board of Nursing issued respondent a letter of reprimand based on the following findings of facts. On or about June 12th, 2024, ASBN received a complaint was submitted to the Arkansas State Board of Nursing alleging, in part, the respondent failed to provide CPR when notified direct care staff that the patient had stopped breathing. Respondent failed to assist in CPR when administered by EMS. An investigation was conducted by ASBN contractor Rhonda Mayo. The respondent was employed by Hickory Heights in rehab May 2019. Respondent responded to the investigation, stating her previous work history and that she had worked for Hickory Heights Rehab on 2 separate occasions. The respondent documented shallow and apneic breathing with a pulse ox in the 40s and pulse of 47 at 2030. The CNA reports vitals to respondent. Video from the nurse's station confirms that they had a conversation at 23:47 where CNA reports abnormal gurgling breathing noises. The respondent fails to assess the patient with critical vital signs. Respondent continues to converse with the CNA, where the CNA also reports abnormal eye movement from the patient. The respondent reviews the patient chart and verbalizes the patient aspirated earlier in the day. The respondent fails to prioritize the abnormal presentation and vital signs of the patient. States will provide an updraft, and crush her medicines to give through her PEG tube. The respondent fails to make a connection of aspiration-affected airway and the patient's critical pulse ox. The respondent makes no mention to assess the patient's airway or residual stomach contents or tube feed absorption. The CNA returns to the nurse's station at 0:31 a.m. and reports a pulse ox of 52. The respondent completed a televisit with APRN and received an order to call EMS at 0:47. The respondent delays contacting provider for approximately 1 hour and 17 minutes. The respondent did not enter the patient's room or attempt to assess the patient when CNA reported patient EG was not breathing or start CPR on patient when was pulseless and apneic for 15 minutes prior to EMS arrival. The EMS reports they were unable to visualize airway due to vomit present. CNA reported that the tube feeding was turned off at 23:51. This was residual and aspirated tube feeding contents. Continue.
Yes, yes.
ASBN issued a letter of reprimand for violations of Arkansas Nurse Practice Act, Arkansas Code annotated 1787-309. The board shall have the sole authority to deny, suspend, revoke, or limit any license or privilege to practice nursing or certificate of prescriptive authority issued by the board or applied for in accordance with the provisions of this chapter or otherwise discipline a licensee upon proof that the person is unfit or incompetent by reason of negligence, habits, or other causes, is guilty of unprofessional conduct. Arkansas State Board of Nursing Rules 17 CAR 126-102, 7AI and 8A and AH state. Negligence means the failure to do some act of nursing that a licensee should do, guided by those ordinary considerations that regulate the practice of nursing. 8, unprofessional conduct includes but is not limited to the conduct listed below. A, failing to assess and evaluate a patient's status or failing to institute nursing intervention which might be required to stabilize a patient's condition or prevent complication. H, causing suffering, permitting or allowing physical or emotional injury to the patient, or failing to report same accordance with the incident reporting procedure in effect with the employee, institution, or agency.
Okay. So the letter of reprimand, you noted there were about 8 points after those first 2 points that talk about the employment that kind of outline the issue of what occurred. And you said that Ms. Mayo provided an investigation report?
Yes.
And did that include copies of videos that were provided by the facility?
Yes, it did.
And have you reviewed all of that? And is that the information from that that you used to determine the violations listed in the letter of reprimand?
Yes.
Okay, would you go through those and start with the videos? I think we'll show videos, and it may be a little difficult to hear the audio. That's why it was turned up so loud for the first folks. And the videos are very long, so we broke it down into the relevant segments so we'll start the first video, and then after we see the segment, then ask Ms. McVeigh to explain what that indicates.
And can you mute all the microphones right now so it?
Good job. People stay reading like this. So, and then they've been on the night, stops for just like that. And we catch quickly on, and her, posted that it's like 40 pounds. But her blood pressure is 130. Something. I really can't. She's breathing. She made it from a noise. I'm not gonna give her, I don't care. I don't think you need, but I think we'll give her. She actually had a long time. Great. I'm not gonna check that out too.
Just ask Ms. McVeigh to explain what that shows and whether or not you listened to it closely and tried to determine what's being said.
Yes, sir. So that first video is from 2347. It's between the respondent and a CNA. The CNA reports that her oxygen is 42 and that her pulse is 40 something. The CNA continues to say that, well, the respondent asks if she's breathing, and the CNA continues to say that she's making some kind of noise and that she's having a hard time breathing. The video is hard to hear, but as you listen to it more and closely, the respondent will say that they're going to give them an updraft and check her O2. These vital signs are abnormal and should elicit a more emergent response. The abnormal breathing is indicative of agonal breathing and a near-death sign.
So a different response than an updraft?
Yes, sir.
Okay. All right, let's show the next video segment, please.
She a full color. She done change everything ready to do it. I'm gonna change that oxygen, get up there, the bump it up some. For my, her eyes, speak. Oh, God. It's like that.
Okay, what did you determine from that segment video?
That next segment is just from the next minute at 23:48. The respondent does acknowledge that the patient is a full code. They continue to talk more about giving the patient an updraft, and the CNA will report that the patient eyes are making a like quote unquote fixing motion. She makes a hand motion with that. Again, just reiterates that the respondent has failed to ensure that this patient has a patent airway or have appropriate response to critical vital signs.
Okay, thank you. We'll show the next video segment.
Unless you got pneumonia. Let me go push her tears up with her medicine too. Make it comfortable.
This next video is from 2352. The respondent states that she's going to crush up the patient's daily medications and put them in the tube. Again, we should just be checking for tube feeding absorption, residual in stomach, a patent airway, and daily medications would not be a priority with a patient in this condition.
Thank you. Okay, we'll do the next one.
I'm going down to 3 pages, but that was the last one, and over my knee, right here. Been a 52. Yeah, and it just kept going back down. It'll go up, then it'll go back down. And I'm getting up dressed, nasal spray, we gave her YouTube and everything. And she hadn't realized she was looking, they should, the way she breathed, and yeah, they should say, no, I ain't got any. Yeah, cause I'm pretty, that like that, I'm pretty sure she didn't just start. That didn't just start. I'm just gonna, y'all see what these are here? Yeah. She's like, come, stop, because she's asking me all this stuff.
Thank you. Would you explain what the relevance of that section was?
Yes, sir.
Mhm.
This video is about an hour later. It's at midnight 31. The CNA reports back to the respondent that she has taken or retaken the pulse ox a couple of times, that it's going up and down, and the number that she does report to the respondent is 52. The respondent will say that she's given the patient nasal spray, the updraft, and again, this would just reiterate that these are not appropriate interventions for a pulse ox of 52.
Okay, thank you. We'll play the next segment, please.
Margaret, yes, I think it's too late. She ain't breathing at all now? No. You know, she's been trying to do it. But Mary was going away. We just leave her alone to Mary get here and do what they got to do.
Okay, so what happens here?
Yes, sir.
Okay.
In this last video, it's at 1:03 in the morning. The CNA reports to the respondent that the patient is not breathing. We've already determined that the patient is a full code. The patient will stay in her chair if the video continues from 1:04 in the morning until 1:23. Rhonda's reports tells us that EMS arrives on scene at 1:12. And again, for a patient with a full code and a report that they're not breathing, these were not appropriate interventions. The nurse should have initiated a code.
So what time was it that the video showed she was informed the patient was not breathing?
1:04.
And the EMS arrived at 1:12?
Yes, sir.
Did it take them an additional 5 minutes to get to the patient location?
Yes, sir. Their narrative will say that they didn't receive the full patient room, that staff is confused and uncertain why EMS was called to the facility.
And what does respondent do during this whole time?
If you continue to watch the video, the respondent does not get out of her chair until 1:23 in the morning.
Okay. Now, were there also some documents attached to the information provided by the facility that's attached to Ms. Mayo's report that you think are relevant in establishing what occurred during this hour and a half time period?
Yes, sir.
If you'll go through those, just, and you don't have to pause, you can just explain those. I think there's 4 of them.
Yes, sir.
So,
So just to reiterate the things that we did, attachment 21 is the narrative from the EMS. They will say that the call was received to them at 0:56 and they were en route at 0:58. They arrived to the facility at 1:12 in the morning. And as we previously stated, they have difficulty finding the patient. The staff is uncertain why EMS has been called. Attachment 21 has the narrative from EMS that says there's a significant blood and vomit in the patient's airway. Crew was advised by nursing home staff that patient had a recent history of pneumonia and had been vomiting the day prior. Crew noted what appeared to be a full canister on the wall next to the patient's head on arrival. Crew suctioned significant amount of blood and vomit-like secretions out of patient's ETT. Crew noted bilateral coarse crackles. Patient has last been seen at 23:30 by a nursing home staff member when she complained of shortness of breath. That narrative would just show that respondent should have ensured tube feeding was turned off if appropriate, or received an order to turn it off, and to make sure that tube feeding was being absorbed. Continuing on, attachment 32 has a narrative from May 21st, 2024 at 12:55, saying that the tube feeding is infusing at 45 cc's an hour, that it was flushed with 55 cc's per hour, and that the patient's O2 is 95. Further down on that attachment 32, the respondent charts May 22nd of 2024 at 1:38 p.m. In part, infusion, Nutrim 1.5 infusing at 45 cc's an hour, tolerated well, flushed with water. Respirations are even and unlabored. This is 12 hours prior to the patient expiring, and there's no documentation in the medical record of when the tube feeding is turned off. The videos do say from the CNA that it was turned off, but it is never reflected in the medical record. There is charting on attachment 33 that the respondent charts at 23:30, shallow apnea breathing, updraft ordered, pulse 47, 52% pulse ox. Returned to office and contacted Access Medical, gave an order to send her out. Patient arrived. Patient was not responding when they arrived. And this narrative has a lot of inconsistencies from our video. And again, just makes light of the time that the patient was rounded on at 23:30 and EMS does not arrive until 1:12 in the morning. Our last point is in attachment 34, where the respondent charts MIMS arrived and started CPR, worked on her until 1:56 a.m. and called her death. This just reiterates that the patient admits and states that she does not start CPR on the patient.
Okay. I want to go back to that last video. Did you listen to it closely to determine what was actually said by the respondent?
Yes, sir, several times.
And I think it was pretty clear. I think the board heard what was said. I just want to make sure when she was told in that video that the patient is not breathing now, what did she do? What did she say and do?
So the CNA will come in and say, Margaret, I think it's too late. Margaret, the respondent, will confirm she's not breathing at all now. The CNA confirms, and the respondent's response is that MIMS is on the way. We'll leave her alone until MIMS gets here and they can do what they've got to do.
And
The
so,
respondent does not act.
and then MIMS arrived anywhere from 12 to 17, well, I'm sorry. If I do my math right, 8 to
It looks
13
like,
minutes later, right?
yes, sir.
Okay.
From 1:04 to 1:12, yes, sir.
Okay, so I guess there's one of the statements in the letter of reprimand says that she failed to respond for an hour and 17 minutes. There was an hour and 17-minute delay in this time period on the last issue when she was informed that the patient was not breathing was a shorter period. What does that time period cover, the 1 hour and 17 minutes?
So the first critical vital signs are reported at 23:30, and the respondent calls the APRN for orders at 0:47.
Okay, so you think that because of the information that was conveyed at 23:30 that she should have called the APRN at that time instead of delaying?
Yes.
Okay. Thank you. That's all the questions I have.
Thank you, Mr. Dawson. Ms. Hampson, the respondents exhibits, have you had a chance to look at those yet?
No.
Why don't you go take a quick glance if you could?
Okay. Okay, there's a lot in the first exhibit that I don't have any objection. It's just going to be difficult for me to respond to without being able to see it ahead of time, but that's
You might be able to get that through an examination of the respondent
right.
in terms of
So I
a
have no
nexus.
objection.
Yeah. All right. So thank you, Mr. Dawson. Without objection, it looks like there's two of them. Is that right? Is it just two of them or one? Two of them?
I have one.
Three of them? Four of them?
I have five separate
Five of them.
documents, I think.
Madam President, if you don't mind, just for ease. Well, we're gonna mark them separately. All right, marked as respondents exhibit number 1. It looks like a statement by the respondent starting off with "My name is Margaret Hampton." Number 2, a letter dated or titled "Notice of Unfounded Maltreatment Investigative Determination, Alleged Offender," dated 8/6/2024. We'll mark that as respondents 2. Number 3 is a Judicial Discipline and Disability Commission, dated April 12th, 2023. We'll mark that as respondents 3. Notice of telephone hearing, Arkansas Appeal Tribunal. Looks like it's not, oh no, it's dated August 14th, 2024. Mark that as respondents 4. And then Arkansas Appeal Tribunal, dated June 24th, 2024. We'll mark that as respondents exhibit 5 and admit those exhibits into the record. Ms. Hampton, I need to ask you, Mr. Dawson's done with his questions of the witness. Would you like to ask this witness any questions?
Well, I would like to say that the night of the situation, can I give my testimony now?
Well, I think you're jumping ahead to your presentation.
Okay.
So he's asked questions of the witness. You have an opportunity to ask the witness questions too, but you don't have to if you don't want to. It's up to you. Would you like to ask her any questions?
Okay. Okay, and number 4, respondent documented shallow apnea breathing for patient with a pulse 40 and 47 and 23:30. What this was that when I come on duty, I was stopped by the previous CNA.
Ms. Hampton, that's not a question. That's more of a statement.
Okay.
And I apologize. Again, there's a little bit of a structure and a process associated with this, and I'm going to give you every opportunity to give an explanation. But it sounds like you don't have any questions for this lady. Is that right?
Not at this time.
Okay. All right. Thank you so much. Board members, any questions for this witness?
I just wanted to, I know we've heard a lot of timelines and there was a lot in those videos. So I just want to make sure I'm clear on the timeline and how that's working. So we heard about the original report around 23:30, 23:47 on the video. So I guess my questions more come around the midnight 31, 0031, that portion of video. So that's when the CNA came in and it was 52% and she said, from what I could hear, she was just like, the way she's breathing, and said something afterwards, but I noticed that the breathing had changed, right? And that was continued from earlier. And then she talks about that she gave the updraft and all that. So I know you said she didn't get out of her chair. So it looks like she wrote a note or something at 23:52 about crushing the daily meds. What time frame did she actually go to the room and leave the video? Do you know, or around? Was it in between those two videos we watched?
Yes, sir. After the first vital signs at 23:30, 45, she does go to the room.
Okay. And that's when she
does
did the
use the
updraft and changes the tubing and does those things. Okay. But when that report was put in at 00:31 that she wasn't breathing, then at that point she called EMS. Is that correct? After that, at some point after that?
At midnight 30, she gets a second set of vital signs that are still abnormal.
Mm-hmm.
She contacts an APRN that initially doesn't answer, and it
Okay.
almost seems like maybe the protocol is to contact Access Medical if you don't get who's directly on call.
Okay.
So then she does get a provider and gets an order to call EMS at 047.
Okay. And so she called EMS around that time at 0047.
Yes, sir.
Okay. So then between the 0031 video and the 103 video in that time frame, did she leave that office area?
I don't recall.
Okay, it's because you said something about she stayed in her chair until 123. So I know the 20 minutes after it was told to her. Okay. So we don't know if she reassessed the patient at that time. We know we didn't start CPR. We know we didn't do any of that.
Correct. The video is contiguous, so we could check that, but I do not recall.
I don't
that.
know that that's that relevant. I was just
Sorry.
for my clarity. And so then at the I guess biggest part of that video was at the 0103 when the CNA said, I think it's too late, she's not breathing. And then the respondent then confirms she's not breathing. And that's when she said, leave her alone until MIMS gets here. And then at that point, that was at 103. She did not leave her chair for 23 minutes.
Correct. And the
So she
video,
did not respond to the room. She did not assess that patient or even check on that patient herself.
correct.
And EMS got there at 112.
And she
So
stays in-
for the next 11 minutes,
Yes,
we
sir.
let EMS have, because, okay. All right. Well, that will clarify for, I think, what future testimony will be. But that's, yeah. Okay. Thank you. That clears it up for me.
Any,
investigative report, but is that the only protocol that you found, was that they were supposed to call Access or call who was on call?
I did not see that protocol,
Okay.
but if you watch the video through its entirety, you can see that the respondent makes a phone call, this person doesn't answer, and then she makes a different phone call.
Okay, thank you.
Can I just have, excuse me, one question for confirmation? Did the respondent come on to her shift at 2300? So all of this starts about 30-ish minutes after
Yes.
she comes onto her shift. Okay.
any other questions from the board? Ms. Dawson, would you be so kind as to call your next witness, please?
Yes, I call investigator Rhonda Mayo.
You want me to identify myself? Rhonda Mayo, contract nurse for Arkansas State Board of Nursing, registered nurse.
Thank you, Ms. Mayo. Do you conduct investigations when complaints are made to the Board of Nursing?
Yes, sir.
And did you get an assignment and conduct an investigation in this matter?
I did.
And did you gather information? Did you gather documents and videos from the facility?
Yes, sir.
And did you compile that into a report and provide a copy of an investigation report back to the board staff?
Yes, sir.
And I think that report's been entered into evidence as exhibit number 6. What was the cost of your investigation?
The total cost was $962.50. It's a little different than what's written in the form.
Okay, so it says $1,000 on the exhibit, but it was how much again?
$962.50.
$962.50. Okay, Now, you've heard mention, you heard the testimony of Ms. McVeigh here today on the videos that she talked about and the exhibits, attachments that she said she referred to that she thought were relevant to the issues that were listed in the letter of reprimand. Or is that all information that you gathered as part of your investigation?
Yes, sir, it is.
And did you yourself look at those videos and listen to them?
I did.
And I think your kind of outline of what those videos said are on page 54. Was there anything in Ms. McVeigh's testimony that was inconsistent with what you observed when you watched the videos?
No, sir. It's a very lengthy video, and there's a lot of the respondent being in the office. So I watched it multiple times.
Okay. And the test is what you observed consistent with the testimony that's already been provided today?
Yes, sir.
And on page 54, would you just read the last paragraph where it says a few minutes later and read what your observation was that you recorded there?
The video of nursing station started on 5/22/24.
No,
Oh, sorry.
not the whole thing, just that very last paragraph, a few minutes.
A few minutes, oh, excuse me. A few minutes later, CNA enters nursing station reporting to respondent. I think it's too late. She ain't breathing. Respondent, not at all. MIMS is on their way. Just leave her alone. And MIMS will do what they need to do. Respondent remains in nursing station until after arrival of a MIMS.
Thank you. That's all the questions I have.
Thank you.
Thank you, Mr. Dawson. Ms. Hampton, do you have any questions for this witness?
Well,
All right, thank you very much. Board members, any questions? Oh, did she say yes? Did you say yes?
yes, because I don't agree with how the tape was. But the fact of it is, when I come on duty,
Okay, again, I'm sorry, Ms. Hampton. That's not a question. That's more of a statement, if you understand, okay? Board members, any questions for the witness? All right, Mr. Dawson, any other witnesses?
No.
Do you rest?
Yes.
All right. Now, Ms. Hampton, it's your turn, and you can explain to the board what happened, what transpired. It's really helpful. So do you have a copy of the order and notice of hearing in front of you?
I do have.
You're going to get some help here, showing you where it is.
This one.
Okay. So there's allegations of fact that have been pled against you. And if you would be so kind as to explain to the board why you think those are wrong, that would be very, very helpful. So you kind of stay on point. And then you got 5 exhibits that you introduced. And it would be very helpful if you could explain to the board why those exhibits are relevant. I know you have your statement in there, but there's some other things in there that were introduced. And honestly, I'm uncertain how they help you out. So if you could explain to the board why you wanted the board to look at it, that would be helpful too. So go ahead, ma'am.
Well, in the order that it's stated, things didn't happen the way that it really stated that it did. Now, at this point, do I give my testimony about how things happened?
Go ahead. Now you can go ahead and testify. And then after you're done with your statement and after you're done with your explanation, Mr. Dawson's going to go ahead and ask you some questions, I believe, and the board's going to ask you some questions too, okay?
Okay.
All right. Go ahead, ma'am.
Okay. On the night of the situation, I was coming on duty. I was walking down the hall. A CNA from the 311 shift coming out of Miss Gray's room. She stopped me. She told me that the patient's been sick throughout the day, vomiting. I turned around, went back into the room to look at my patient. She had vomited on the side of her bed on the sheet. She was breathing, eyes awake. She's laying on the left side. The aide told me that somebody suctioned her, but she don't know who suctioned her. Okay. So after then I thank her for the report. I proceed to the nurse's station to get report from the nurses. When I arrived at the nurse's station, there was 2 nurses there, the supervisor for 311 and Marquita. She had the back half of 300 Hall. So I asked her, is anything changed, anything new that I need to know? She told me all her patients were just fine. So she wanted to count the narcotic drugs with me, and I did. Everything was correct. After counting the narcotic drugs, she and the supervisor, they left the facility together. And the other nurse, this nurse, Marquita, I gave report to, she had the back part of 300 Hall. 300 Hall was divided for 2 nurses. The day nurse gets the front part, and then the 311 nurse gets the front part. So Rhonda was the day nurse, evening nurse for 311, excuse me. So Rodney has not made into the building, so I asked my CNA to go get a set of vital sign on Miss Gray in the light of what I was informed. And so while she was getting vital sign, Rodney came into the office. I asked Rodney, is there anything new, anything different that I need to know? He said, no, just the usual. And Miss Gray had her updraft. She's still on antibiotics for pneumonia. That was all the report that I got from Rodney. So I immediately went down to Miss Gray's room because of the report that was given to me by the CNA. Then she was breathing. She was laying on her left side, breathing. Like I said, I've seen the vomiting on her pad and everything. So after looking at the vital sign that my aide gave me, I go ahead and started her. I gave her updraft to help her with her breathing to get her pulse oxygen level up. I did that. And then I stayed with her until it was completed. Her breathing went from 59% to 70, 80%. So then after that, I left out of the room. I told my aide, stay with her. I'm going to the office to make phone calls because I need to get her out to go to the hospital to be assessed. I went to the office. I called Medical Exchange, and I told her about the situation, and she told me she's going to send me a link to my telephone because she wanted to assess the patient as well. So when I went back to the patient room, I called Dr. Shirley Morgan back, and she assessed the patient. She gave me an order to go ahead and send the patient out. So I told my aide, I'm going to the office now. I'm going to call Mills for transfer. Then I'm going to get her transport paper ready. Then I'm going to call her daughter to let her daughter know what I need to do for her mom. And I called the ADON to let her know about the situation. She told me, okay. The patient daughter told me that she would meet her mom at the hospital. Okay, and then I said, all right. Then I went back. I gathered the information. I was going back to the patient's room. And then when I got there, Mills had already arrived. They was in it before I got there. So my aide, they told me that she had stopped breathing, when Mills got there. So what I did, Mills asked me, is she a full cold or hospice? I told them she was a full cold. They started doing CPR on her. In the process of doing CPR on her, they asked me, did she vomit? And I told Mel, not since I've been on duty. I was informed that she'd been vomiting throughout the day. At that time, patient daughter called my phone and she told me she's at the hospital, but her mom is not there. So I told her I'd step out of the room and I let her know that her mom was having CPR, but she didn't survive the CPR. The daughter told me I'm coming right up there. And I told her, all right. I got my aide and we got bed aid because the patient had a roommate. We got her out of the room and we took her to another room so I can provide comfort and a better surrounding for her daughter's visit. So after I had helped my aide to take this patient to another room, I came back into the room, finished tidying up things to make things presentable for her daughter. So when her daughter did arrive, the police had made it, and they asked me to call the doctor that I'd been talking to so that she can pronounce the time of death, because MIMS could not do that. And so I did. And so she pronounced the time of death was 01:56. So the police remained at the door until the patient's body was picked up at 4 o'clock that morning. So when the daughter came down to finish business with her mom, she came to the office and asked me what had happened. And I informed her what was informed to me. But I've been sick throughout the day and she'd been vomiting. So I asked her, has anybody call you about your mom condition change? She said, nobody's never called me about anything. I was the only nurse that called her. And I apologize for that. So while I was in the office, I pulled up day shift 73 nurses note and 311 nurses note. There was no documentation about the patient been vomiting, condition change, or they contact the daughter at all. No document whatsoever. And so I apologize, to the family about her losing her mother. And after which, when they left, because I was already behind, I had been asked that a patient was one of their pain medicine. I let them know I'm on my way to take care of them. So then after 4 o'clock, I started to looking at my paperwork and stuff so I can go ahead and started giving my medication to my other patient. So in the process of doing that, I was getting behind. So I was trying to tidy up everything for the day shift nurse come on for her role of duties. So the day nurse came in at 6:30. And so I gave a report to her and I let her know, I said, we lost Miss Gray last night. To my surprise, she burst out, say, what? I told Shannon to come in off her break to check on that patient because she'd been vomiting sick throughout the day. On a 2 hours lunch break, she sat her home out. I was not even aware of none of that. So then when that's Brooks. Brooks was the day nurse. That's what Shannon was saying about Miss Brooks. So when Brooks came in at 7 o'clock, I gave her a report on the patients. And I let her know that everybody's okay, but we lost Miss Gray. To my surprise, Brooks says she's probably better off. I couldn't respond to that because I was hurt behind that. So then after I counted with them and gathered my stuff together, the administrator had arrived about 5 that morning, and he asked me why did I not call him to let him know the police was in the building. I told him that I apologized, but I was trying to get everything done in a timely manner. So he told me, you should always call me to let me know when the police is in my building. I said, yes, sir. He said, before you leave, I need you to come to my office. I need to talk to you. I said, yes, sir. So in the process, as I'm trying to get all of my notes and gather all my information together, my also DON had asked me about the situation, and I explained it to her. She said, Miss Hampton, before you leave, go by Nick, and because he want to talk to you. And Nick was upset because I didn't call him about the police, and I did apologize to him for that. But I was doing so many things trying to get everything done in a timely manner. So, in doing this, excuse me. And I told Nick, I said, Nick, the patient should have been out before I came on duty because she'd been sick throughout the day. Nick got upset with me. Don't tell me what the other patient should have done. And, don't try to cover your faults. I said, I'm not trying to do that, sir. That's why I immediately called to Mims, and I immediately called the doctor trying to get her out to the hospital because I knew that she needed to go to the hospital. So anyway, behind that, they told me that effective immediately, you have no employment here in my building. And so I finished gathering up everything, and then I left this facility.
Thank you, ma'am. Mr. Dawson, any questions?
Yes, I've got a few. I think some of the things that I might just be easier for me to recall Ms. McVeigh to make some comment on what we just heard, but I did want to ask a couple of questions on your exhibit number 1, where you show everything that happened. Then at the end, you say addressing the investigation allegations. Under number 1, you say the patient had not stopped breathing prior to Mims' arrival. But we just watched the video where you were told anywhere from 8 to 13 minutes prior to Mims reaching the patient that the patient was not breathing, correct?
Yes. And I did ask Nick, because he was saying all I did stay in the office. Nick, that's not true. I said, you can just roll the camera back, you'll see. And he never would roll the whole camera back. He'd do part and stop, and he wouldn't do it.
Okay, but
I want us to see that together.
we just watched it together, correct?
Well, I don't know what he put together, but he wouldn't do it at the time that I asked him to do.
I'm talking about what we just saw. What we just saw was you were told 13 minutes before Mims reached the patient that she was not breathing.
But I
So
understand,
this statement is not accurate, correct?
not in the way that he outlined everything to be. Because I'm the one that told my CNA when I came on duty, her being sick, to get set of vital sign so I can further assist her to see what I need to do. That's why I got those vital signs from her, and I called the doctor.
Right, but that wasn't more than an hour after you came on duty when you called the doctor. It was after you got like the second set of vital
It was
signs.
kind of like, I only got really just one set of vital signs from that aide. All this other stuff is something that I think he just put together, because he never would, let me watch the whole tape with him. He wouldn't do it. I said, let's go back and watch all the tape. He wouldn't do it. He
Okay,
wouldn't do it.
you're referring to what happened at the facility, but we saw the tapes here, and we have the timeline established from the medical records and the timestamps on the videos. I think you made another statement that you claim that she should have been sent to the hospital earlier in the day, but you received those set of vital signs at 11:30 and didn't call the APRN for over an hour after that,
That's not
correct?
true. I
So you
called
disagree
imme-
with the
I
timeline?
called immediately, but like I said, I asked him to let me just look at the whole footage with him. He wouldn't let me do it. I don't know whether been taped part of it, put together what. I know it didn't happen the way he provided to be. It didn't happen like that.
All right. You made a statement when you were told that the patient was no longer breathing, that you'll just wait for MIMS to arrive. Why didn't you initiate a code blue and initiate CPR immediately until MIMS arrived?
Okay, again, I understand what you're saying. When she told me that, okay, I had already been and gave her everything in her vital signs had went up and everything. By the time when MIMS arrived there, that's when she had stopped breathing. And I told her, that Mim was on the way. Because, and then, but Mim was on his way. But I went down there with the paperwork and everything. And as I was entering the room, Mim was already made it there, and she had stopped breathing. I think these bits of pieces of tapes, I think some of this stuff was just put together because it really didn't happen the way that he said that it happened. It really didn't.
Okay, so you're disagreeing with what we watched on the video?
I'm disagreeing because it could have been tampered with. Because when I asked him to let me see the whole footage with him, he never would do it.
But I think it was clear, some of the audio hard to understand, but the last part was not clear. When the CNA told you she's no longer breathing, you said something to the effect that MIMS is on their way. We'll just wait for them to get here and do their thing.
When I told her that, yeah,
So,
I was
and there
still
was-
on my way down there. See, the way that he fixed things and worded things, like I say, I feel like the veto was tampered because everything didn't happen the way he said it did. That she came back and bought me this. She gave me those vital signs one time. She didn't come back and tell me about the eye moving. She did not do none of that.
Okay, so
This
you're
is-
disagreeing with the video that we saw today?
I'm disagreed how it was put together and how it was relayed, like I didn't do anything for the patient.
Okay. Have you completed the letter of reprimand? I know you've appealed it, but sometimes people go ahead and get the requirements. Have you completed the American Heart Association Basic Life Support class
Yes,
since
sir.
being issued the letter of reprimand?
Yes, sir.
Have you provided a copy of the completion certificate to the board staff?
I think I sent it in to them. I did.
Okay. Okay. I was told that, yes, you have done that. Okay. I think that's all the questions I have. I would like to recall Ms. McVeigh when the time comes. Yeah.
You can go ahead and do that during rebuttal, Mr. Dawson.
Okay.
Since you're rested. Board members, any questions for Ms. Hampton?
I don't think I'm on. Ms. Hampton,
Yes, ma'am.
you said that the 311 CNA told you that she was sick before they left shift, correct?
Yes, ma'am.
And you walked in the room. So if it was 311, it's probably right at 11 you went in the room and saw the vomit.
Well, actually, it was at the beginning of my shift.
Okay, so that would have been 11?
Mhm.
Okay. Can you define immediate for me?
Do what?
Immediately? What does immediately mean to
I
you?
mean, like I just turned around, I didn't do anything, went in there and checked my patient and looked at her.
Okay, but
And-
for you to contact, you said you immediately contacted the provider. What does immediate mean to you?
Okay, the immediate mean to me after I had gotten report, from my nurses. Nobody didn't say anything to me about her being vomiting, being
Okay,
sick throughout the
but
day.
but you visibly saw the vomit at 11 o'clock.
Yes,
right?
on her shift.
I'm not here to discuss what 7 to 3 shift done, what 3 to 11 shift done. You assumed responsibility of her at 11 o'clock.
Yes, ma'am.
You saw the vomit and the abnormal vital signs on your shift.
Yes.
The provider didn't do the telehealth visit till 12:47. So you took shift at 11 and an hour and 47 minutes went by before the provider, I'm looking at her note right now from Shirley Morgan, 12:47 a.m. That's not immediate.
Well, see, it was good. I went down, since I didn't get a report from that 311 male nurse of the status. I went down to her room, and then after they showed me the vital signs and everything, then I started to giving her, went back to the office to get her updraft and stuff, to get her set built back up. And then I did that, and I in her left side. So then I come back after giving the updraft, her set level went up and she was breathing. Okay, then after that, after giving her updraft, I told my CNA that I need you to stay in here with her. I finished doing my updraft on her and everything before I left her room. I let her know I'm supposed to go to the office. I'm gonna call the doctor so I can get her out to go to the hospital. I called the doctor, medical exchange, and I let her know about the patient being sick throughout the day, about the vital signs, and she told me that she's gonna send me a video link to my phone because she wanted to assess the patient.
Yes, ma'am. I'm very aware of how the process works with telehealth in nursing facilities. My thing is you keep using the words immediately, you immediately done things, but there's an hour and 47 minutes from when you visibly saw the resident having a change of condition before you notified the provider that there was a change of condition on your watch. And another question I do have as well is if you when you called MEMS to let them know that she was going to be sent out, I don't understand how come it took them 5 minutes to gain entry into the facility and find where the resident was that needed assistance. Because, you know, if the resident, for one, wasn't breathing, I would have at least had half of my building on watch out for a EMS to come to point them in the direction of where they needed to go. But there was absolutely no urgency in that video whatsoever.
I understand what you're saying, but like I was saying, that when I come on, then I see how my patient was looking. I went back to the room and checked on her. I went to the office to get report on her from the nurse. I didn't get a report from the nurse that she been sick. I did not get that from him that she'd been sick throughout the day. He just told me everything's the same, the usual. Miss Gray got her, she's still on antibiotics for pneumonia, and he left the building. So after that, I went back to Miss Gray's room. And she was, you know, and after I went back to Miss Gray's room, she, like I said, she was laying on the left side. Then I gave her updrafts and stuff because I got my vital sign from my CNA, and I told her to go get the vital sign. And I go ahead and look at the vital sign. I went and gave her updraft and her medicine to increase her pulse oxygen level. And I stayed in there till it was done. When I left out of the room, because everything went back up, her pulse off from 59 went from 78 to 80. So I let my CNA know that I'm going to the office now. I'm going to make some call to the doctor to get her out to go to the hospital. Well, I made the phone call to the doctor, and I let the doctor know through medical chain. I spoke with Shirley Morgan, and Miss Morgan told me about she's going to send me the video to my phone because she wanted to assess her. And I did. I went back to the room so that she can assess the patient. She said that, go ahead. She gave me permission to send her out. I went back to the office. Then I called Mims for transfer and got her transfer papers together. While I was in the office, I called her daughter and I informed her, I'm sending your mom to the hospital because of her condition change. She'd been bumming throughout the day. The daughter say, all right, I'll meet my mom at the hospital. Okay, so when Mims came in, I was walking down to her room with the paperwork in. So Mim asked, the patient, nurses say she's Margaret, she just stopped breathing. Okay, Mim asked me, is she a full cold or hospice? I said she's a full cold, and I gave them the paperwork. They started CPR on her. In the process doing CPR.
Correct. They started CPR, but the CPR should have been started a long time before they even got in the building.
Because I don't agree with the time set that.
Well, I mean, the time was on the video.
Well,
when they
like I
told you.
say, things can be tampered with because he never would let me look at the whole video like I asked him. So it didn't
I mean,
happen.
that's a huge tampering of videos is,
Yeah, with what he's saying, because it didn't happen the way he said.
well, I'm done. Thank you.
Okay. I got a few questions for you. So, how long have you been a nurse?
About 33 years.
What does a full code order mean? When someone stops breathing, when someone codes, what does that mean?
CPR.
And did you do that?
No, because when I was in there
No,
with her,
I didn't ask that. I said, did you do that?
I didn't start it. Mim started
And why?
because she was still breathing at the time that I was with her.
At 1:03, she was still breathing.
Like I said, I don't agree with
You
his
don't know
time
because
set.
you didn't get up.
I got up.
No, you didn't. You sat there for 20 minutes after the CNA told you at 1:03 a.m. that your patient had stopped breathing. You confirmed that with your own words. And you said, I wrote it down because it shocked me. Leave her alone until Mims gets here. She's not breathing at 1:03, a full code patient. And then Mims arrives at 1:12 and does initiate CPR, but you don't even go down to the room where Mims is until 1:23.
Again, that tape, where we watched.
Listen, it
again,
is
that-
digitally time-stamped. That's why we have tape, because human memories fail.
Yeah,
But digital timestamps do not. So that is evidence. That is in the evidence. So if you want to talk about tampering, then you need to take that to a higher court against them, that they tampered with all this tape and did all that. That's a whole different thing. But we have evidence with a digital timestamp that says you sat there from 1:03 to 1:23 while your patient was not breathing. So, we've heard a lot where you got a set, well, you didn't get a set of vitals, you sent someone else to get a set of vitals. And so you could assess what you needed to do. When the CNA comes back, there was a separate set of vitals because obviously, or at least an O2 sat, because she came back at 12:31 and said her O2 was back down to 52%. And something about the way she's breathing. It wasn't that audible, but she was talking about the way she's breathing and the oxygen was at 52%. So she had to have she reported some, maybe not a full set of vitals, but at least the O2 sat, which was what was pertinent at the time, it sounds like. And you took no action past that time.
I understand what you're saying, but I have been really working with that situation. She only gave me, because I told her go immediately give me a set of vital signs while I was waiting on the patient, the nurse to give me the information of his group of people. So when she gave me those vital signs and I looked at them, that prompted me to go down and to give her updraft treatment. And I did, to get her set up, reposition her and pull up in the bed. Okay.
But that's not at 12:31. That was at like 11:45 or somewhere around there. Like, a patient's condition can change and you have to respond differently. So because you got vitals at 11:30 and you did some actions, which I will admit, you did something at that point. It may not have been the right emergent protocol for the condition of that patient with an O2 sat in the 40s, but you did some action. You did an updraft, you changed the tune, you did some things there. But past that point, we didn't do anything. And that patient's condition, while you say the O2 came back up a little bit, still 80. I mean, come on. The O2 came back to 80, but then that patient continued to decompensate and there was no emergence. We just kind of sat on the phone, which, I mean, I understand those calls have to be made, but there was a lot more that needed to be done for that patient than making a couple of phone calls and letting them sit for 11, 9, however many minutes, depending on the timeline that MIM says they actually made it to the room, for a patient to sit without CPR.
Again, I agree. I disagree with the time frame and how things was put together by him, because it didn't happen the way that he said that it happened. She didn't come back and give me two different set of vital signs, whatever. When I look at those vital signs, I went down and assessed the patient, gave her updraft. Everything, I stayed with her until everything was.
We've heard of that, ma'am. But that was at 23:47. That was at 11:47, okay? When she came back at 12:31 and said it was 52%.
She didn't come back. She
didn't?
No, sir.
So that video is AI.
It was chopped up, but it didn't happen the way it got chopped up.
So when it said on that video, time stamped in the corner, it had the date 0031. It also had the date at 23:47 when she came in, and that matches up. You're not arguing with that tape, right? At 23:47 when she comes in and tells you the O2's at 42%, the pulse is at 40, she's making some kind of noise, and then you said, I'm gonna go give an updraft. You've told us that part multiple times, so that happened. But the other part, in the crucial times when your patient stopped breathing, that stuff didn't happen. So video is true at times, but not at others.
My thing is that I know that I was in her room and I stayed with her when Mims arrived.
You were in the room when MIMS arrived.
When I said, no, I was with her and I stayed with her until when Mims arrived there.
No, ma'am.
When Mims arrived, that's what I'm saying. When they arrived, she had stopped breathing. So Mim asked me if she was full cold, or hospice. I let her know that she was.
Because no one started anything. And you knew at 103 she was not breathing.
She just stopped breathing when Mims arrived down there.
All right, I'm done with that part. The other things I want to talk about, your statements that you brought. So this Arkansas Appeal Tribunal, what is that referring to? Yeah. Is that saying that you're not guilty of this? Or is that, because I don't think it does. It looks like this. There's 3 sheets associated with it.
Yeah, I got it.
Yeah.
I see that. And this right here is when I received a telephone hearing call, and they was going to connect me with Nick, calling my job, and they was gonna do a telephone hearing. And I had stayed on the phone and line talking to them about my situation. And then they were still trying to reach Nick. Nick never did respond back to the call.
But it's just about unemployment.
Dan?
It's about unemployment.
Unemployment.
Says about your unemployment insurance benefits.
Okay.
So I just wanted to note for the record that, I mean, we're not concerned with unemployment and what their decisions are. That doesn't have anything to do with your nursing license. Letter of reprimand. Wow. We've seen a lot today, but I don't have anything else for you.
Ms. Hampton, back to the video, just to be concise, whether you agree with the timeline or not, we heard and saw the video that you were informed the patient is not breathing. There wasn't a code called. You didn't get up and go to that patient's side. You didn't initiate CPR. You said, let's wait. So it doesn't matter when the time was. We watched what happened. As a nurse who currently has a family member in long-term care, I am mortified, horrified by your actions. So I don't think there's anything else to say. Letter of reprimand is a blessing.
All right, any other board members?
Are you currently working anywhere right now?
No, ma'am.
So but you have an active license, but you are currently unemployed.
Yes.
Are you seeking employment?
Not at the moment.
And you kept bringing up that this video was tampered with and all of that. And I'm not going to go into that in detail because just what all we've said today and what all testimony we've heard. But I will say, if you go back and you look at EMS statements by Metro EMS, it aligns with exactly what that video states about no CPR was initiated until they arrived, which obviously is a huge fault on your part for not initiating CPR, despite what anybody told you on a telehealth visit. Airway, breathing, and circulation, right? ABCs. Those are the things that should have been initiated. Not worrying about contacting anybody initially. The patient is who should have been taken care of first. Those are basic CPR that we all know. So despite what you think about that video and how you think it's altered, it is interesting to note that EMS matches exactly with this video about no one notifying them or allowing them to get into the building. They actually didn't start CPR. If you look at their timestamp, it's 1:17. So they arrived on scene at 1:12 and it took them till 1:17 to initiate CPR. She was not breathing at 1:03 and once again was a full code.
Okay, I understand what you're saying. I never really left the patient and not do anything for her. The reason why I didn't start CPR is because each time I was there, she was breathing. She was breathing, that's why I didn't start a CPR. So, like I say, I don't agree with how those facts that he put together and say that the CNA came to me more than one time about her vital sign, but that was not true. I did not wait an hour and something to do anything for her. That's not true, because I was down in her room, working, getting things together, doing things. And each time I was in there, I put my eyes on her, she was breathing. And that's the reason why I went to the office to make those phone calls, so I can go and get her out of here, because she didn't look too good to me. And that's why I was telling my administration, she should have really been out before I got there, since she'd been sick throughout the whole day. Nobody bothered to call the doctor. Nobody bothered to call the daughter. Nobody charged anything at all on her. I was trying to do everything in a timely manner to get her out, because I know she needed to go out. So by the time the MEMS did arrive, you know, and I was walking down that way to her room again, and, you know, my aides told me that she stopped breathing. And that's why MEM asked me, is she a full cold or is she hospital? And I told them she's a full cold and showed them the paperwork. And they started CPR.
All right, any other board members?
Do you feel like in the future that you are aware of when someone may or may not need CPR or not?
Yes.
I hear you talking about how, well, the last time I saw her, there's truth in what you're saying in your mind.
That's
The
what.
last time you laid eyes on her, she was breathing. When the CNA told you she wasn't breathing, it's when you get up and you run and you go to the room. You have an order to start a code. You already had that. You didn't need a physician on the other end of the line telling you to do that. So I do believe that you believe what you say about, well, the last time I saw her, she was breathing. That's true. The last time you saw her, an hour or so prior. You seem to be real concerned about what the other shift done and things you done. Philip's already addressed that there were some things that you done. There's some lacking there as well, but just so you understand what the problem at hand is, the CPR. Whether it was initiated, when it was supposed to, or whether it wasn't. Did the CNA come and tell you that she wasn't breathing and you say, we will wait for MEMS to get here? Did that happen in your mind, in your recollection? Yes or no?
That did happen.
When did that happen? In your recollection, when?
Just after MEM had got there, she came back and told me that. After MEM had arrived. Because I was on my way down there to her room to provide the transferred paper and everything.
Okay, I've heard that. I've heard that multiple times. So in your opinion, the video, that you're going to stand on ceremony that this whole video has been altered, that none of that is true. Even after hearing that MEMS backs up the timeframes, even knowing statements that staff members made, you're still, after all this, because my question to you would be, maybe if you got the details mixed up prior to seeing the video, that at some point after seeing the video, that there may be some dawning of recognition of maybe in my mind that went very differently than the way I thought because I was in the moment. Because a letter of reprimand is very generous. It would have been probably best to go ahead and take that. But now what we've got to decide, because you're in front of the board, is whether you have the critical thinking to think through what is critical and what's not, to know how to respond and willing to respond when and how you need to from this point forward. So the decision that's got to be made today is not so much about what you did. You did some things, but the one thing you didn't do was the most critical in the moment. And we have to decide if moving forward, there's something that makes us feel like you will take today and the video and what went on and move forward, if that's allowed, with better judgment, more haste, and critical thinking. So do you have anything to say about what I've just said? Anything you want to say back to us?
I understand what you were saying. And I think that I do think critical. And I'm sorry that things had happened the way it was, but that was not I would never try to not do what is right for my resident. That patient was dear to my heart, and it really hurted me. I stayed in that room and watching her and working with her. Each time I was there, she was breathing. And when I left out to make those calls and things, I was seriously trying to get her out because I know that she need to go to the hospital.
I understand that you wanted her, that she needed to go out, but at what point should it, or should it have clicked? We're going from plan A, which is get her out. Now I'm moving into plan B, which is immediate chest compressions and CPR. That's the missing piece. That's what I'm most interested in, is that moment. Not so much the hour. I mean, there was a lot that went wrong the hour ahead of time, but there was still a saving moment when the CNA come in and said, she's not breathing. And you knew she was a full code. But regardless, that is when you get up and you go to that room and you assess. As CNAs, they're great. They do a great job. You don't even trust what a CNA says about someone's status as to whether they're breathing or not. But there was no movement. There was no rush to attempt it, to even attempt or start CPR. I think your focus was on, I need to get her out, and it never switched over, I need to start. And I was just looking for something that could work with. Thank you.
All right, any other board members? Mr. Dawson, ma'am, do you have, I'm gonna go to the point where you have rested, ma'am. Mr. Dawson, do you have some rebuttal? Do you still need rebuttal at this point?
I think the original testimony.
All right. How about closing statements then? You're gonna waive closing? Ms. Hampton, anything else you would like to add? I mean, I think you've probably said it a number of times at this point, but I do have to give you another opportunity. Anything else you want to say? Because what's going to happen next, ma'am, is the board's going to go ahead and they're going to go into deliberations, right? You're not allowed to address the board during deliberations. So as they discuss this in terms of what they want to do and how they want to handle it, you just have to sit there silently. Now, you can leave the room if you'd like while they deliberate. And once they reach a decision, they'll call you back in and then announce it. You don't have to stay for those deliberations if you don't want to. Please don't wander too far off, because when they do reach a decision, they want you here to hear what they decide, okay? All right.
Well,
Before we go in,
Yeah,
I was just gonna ask a question before we do go into deliberations. Can we get confirmation as to, is our only option as a board to rescind or uphold the LOR?
I was about to get into that as well. Mr. Dawson, I'm looking at the order and notice of hearing, and it looks like the board is kind of handcuffed in terms of a letter of reprimand or not, because it doesn't say anything about potential suspension, potential revocation. It's either up or down, thumbs up or thumbs down on the reprimand. Would you agree with that?
Correct. And Ms. Avery and I, she researched that yesterday because of this question might come up. That's true, I think. And so there would have to be a separate hearing to give her notice of a potential
It's a notice.
suspension or probation.
Yeah, it's a notice issue,
Yeah,
correct?
Yes, correct, yes.
Because what the order and notice of hearing just rested on was whether or not a letter of reprimand should be issued or not.
Correct.
And
yeah.
the president is sharp as a tack because she picked that up right away. So with that, I'll go ahead, call the evidence and testimony to a close and turn it over to the board and the president for deliberations.
Board is now in deliberations. At this time, there will be no further input from anyone. I don't know that there's much discussion. Thank you. Okay, do I hear a motion?
Say something before we do the motion?
Sure, please.
I think we're gonna uphold this letter of reprimand, but off of what council was just sharing, is it possible that we request this person have a new notice of hearing sent for the September hearings to look at probation, suspension, or revocation?
Yeah, and I also think, I mean, in my opinion,
I would like to
think that
consider
he's not working, but there might be, yes, we can talk about that, or even an emergency.
A letter of reprimand is not protecting the public in this case.
Yes, let's bring that up as an order of business. After this hearing comes to a close. Do I hear a motion?
Uphold. You got it, Cassie?
If it can be like retried. Separate. Okay, so before y'all finish writing that, there's been it's been brought up that we might actually have to rescind this LOR and then bring her back but I think we're gonna come out of deliberations because this sounds like it's over my head. So the board is now out of deliberations and we're back on the record.
Yeah, I think logistically, for legal purposes, if you uphold the letter of reprimand, it may be kind of a double jeopardy really only applies in a constitutional sense to criminal, but it's a similar argument that we've already charged her for this. If you want to base future action on the same incident, then you'll need to rescind the letter of reprimand and then reschedule a hearing for the issues that we were here for today.
Okay.
So,
Any questions for Mr. Dawson about that before we go back into deliberations? Okay. Thank you, Mr. Dawson. The board is now back in deliberations. So those are our options. If this needs to be brought back before the board, we need to resend the letter of reprimand today.
I think we do.
Okay. Do I hear a motion? Can I see a motion?
The letter of reprimand originally was 11/24/25. Is that correct?
Let's see.
Yeah, I can look.
Yes. The original,
Yeah,
11/24/25.
11/24.
and no civil penalties, nothing applies. Okay, there's a motion before the board that the letter of reprimand issued on 11/24/2025 be rescinded. And I don't believe we need to add any further communication. I think we've made our directives to the board staff. Signed by Cassie, seconded by Barbara. All in favor? Any opposed? Let the record reflect that there are also no abstentions. That motion will carry. The board is now back on the record. Let the record reflect that the respondent is present. It is July 8th and the time is 10:26 a.m. I move that based on the evidence presented and the allegations contained in the order and notice of hearing, the Arkansas State Board of Nursing finds that Margaret Hampton, license number T001714, has violated ACA 1787-309A6 and the ASBN Rule 17 CAR 126102-8T, and that the board license number T001714, that the letter of reprimand issued on 11/24/2025 be rescinded. Signed by Cassie Gonzalez, seconded by Barbara Hillman. All in favor? Any opposed? There are no abstentions.
Thank you, Madam President. We'll go ahead and mark as staff's exhibit number 8, the motion document that was passed by the board, and admit that into evidence. We'll go ahead and get a copy of that to the respondent. I'll further ask staff to reduce the decision of the board to writing. Make certain that Ms. Hampton gets a copy of that decision along with an information sheet or cover letter that notifies her of her appeal rights moving forward. If there are no further questions or comments from the board, I will call this hearing to a close. We are off the record. I'm sorry. Could you go ahead and go back on the record? Just for the benefit of the respondent, ma'am, you got 30 days in which to appeal this decision. You can get with staff. You can appeal it. I'm not certain where you live, but I think it's either Pulaski County or the county where she resides, if I'm not mistaken. But if you get with staff, they'll be able to explain it better to you in terms of moving forward. And with that, we're off the record.
Board members, we are going to take a very brief recess. We have just a couple of things to do for business, and then we'll go ahead and recess for lunch. But if you guys want to take a couple minutes. Let's come back at 10:35.
That one.
Okay, thank you. Jamie Sims, report to your seat.
That's on YouTube. That's on YouTube.
Sorry, YouTube.
Still on YouTube.
Are you recording?
You're so funny.
Okay, guys, we've got a couple items of business.
We're recording on everything. We're good.
Okay. The first is just to approve our minutes from our June meeting. So I move that the ADH Arkansas State Board of Nursing approve the minutes from June 3rd, 2026 and June 4th, 2026. Excuse me. Thank you. All in favor? Any opposed? That motion will carry. The second thing is we have a waiver application that I believe Ms. Ivory is going to present to us.
Thank you. I'm going to present a waiver that was prepared by Tammy. Okay. Do you have the motion? Make sure you're.
I do, yes,
Okay,
ma'am.
okay, good. All right. This is Denise Nicole Jenkins. She is an applicant for the NCLEX RN. I'll give you a little bit of background on her. She completed the Northwest Arkansas Community College associate degree in nursing, and on April 21st of 2026. She doesn't have any other licenses in Arkansas or other states. On March 17th of 2026, the applicant submitted her initial RN licensure by exam application and marked yes to the eligibility question of being convicted of a misdemeanor or felony, pleading guilty or no contest to any charge. She stated in the message that she could put a little comment. In 2023, my 7-year-old niece passed away and I stopped taking my medication. I stole baby items from Target after she had passed. I was arrested and immediately got back on my medication and started therapy for the loss and how I was facing the loss with things. I have learned from my embarrassing situation. I was also stopped for a similar situation in which the charges are being dropped for it being a misunderstanding. I will provide documentation for both. The court documentations and an investigation timeline. So on about June 17th of 2024, the respondent pled guilty to 3 counts of theft of property, ACA 536-103. The statute for the offense is an automatic bar for licensure according to 17-3-102. And it requires a waiver to take the NCLEX and to be issued a license. Apparently, she was giving fines of $8,114.57 were ordered and adjusted to $6,750. On May 11th, 26, a letter was sent to the applicant stating that the application could not be processed until a receipt from the court showed that all the stipulations and fees had been satisfied. The court documents still showed a balance due to the courts of $1,449.57. And then on May 15th of 2026, a denial letter was sent to the applicant with instructions on how to request a waiver due to the theft of property for bar of licensure. On May 30th of 2026, a receipt from the court showing all fees and fines were paid in full was uploaded to the applicant's ORDS message center. And then on June 15th of 2026, a request for a waiver was received from the applicant through the applicant's message center. She also had submitted a work history form that shows her current employment was at the site safety technician. She's a site safety technician at Jackson Brothers Concrete Finishing LLC. And she presented 3 letters of reference. The current employer submitted a letter of reference stating Denise is an outstanding employee and goes above and beyond, states that she is provided to be selfless and willing to take care of anyone and an amazing worker. The reference letter from the previous program director at Northwest Arkansas Community College states Denise has consistently demonstrated the knowledge, professionalism, and compassion essential to the nursing program. She's built rapport with patients and families, and the instructor feels that Denise can be an asset to wherever she works. She also had 2 other character reference letters that were submitted by P Ridge School stating that Denise demonstrated qualities essentials for nursing and that she would be an outstanding addition to any healthcare profession. And she also, the respondent also submitted a certificate received from the Northwest Arkansas Community College for Outstanding Clinician in Nursing Award. That we have these letters and also the award that seems to have been given April 20th of 2026. And you should have a waiver motion that is from the RN NCLEX and that you can make a decision if she can go forward with that or not.
Anybody have any questions for Ms. Ivory? Comments? Okay, great. I move that based on the evidence presented and the allegations contained in the order and notice of hearing, the Arkansas State Board of Nursing finds that Denise Nicole Jenkins, RN NCLEX applicant, pleaded guilty or no contender to, or has been found guilty of a crime making them ineligible to hold a nursing license as cited in ACA 17-3102 and 1787-309A2, and that the board grant a waiver of ACA 17-3102. Do I hear a second? All in favor? Any opposed? Let the record reflect that the motion will carry.
Thank you.
Thanks, Ms. Ivory. Go ahead.
Okay, I have one quick. We would like to add New Haven Recovery Lodge as an approved treatment provider. I think Kim gave lots of information to you guys in your packet. She also did a site visit and just feel like they would be a good addition to our current list of treatment providers. She's here if y'all have questions, but I told her I thought I could handle it in case.
Any questions from any comments? Okay, I move that the ADH Arkansas State Board of Nursing approve New Haven Recovery Lodge as a board-approved treatment provider. Do I hear a second? All in favor?
Aye.
Any opposed? Okay, the motion will carry.
Allow, I noticed they had a nurse practitioner and a psychiatrist. Will they be able to do the?
That doesn't add them to our
Evaluations.
evals. It just adds them to our provider.
But that is, Kim, is that something we could consider is adding them to our evaluations?
Yes, I'm working on that. Okay, thanks. Thank you, ma'am.
Great. Thank you, Kim. Thanks for that question, Cassie. Any other business?
No, lunch should be here shortly. I do need to see the scholarship committee members very briefly to look at our scholarship recipients. And if you don't remember who that is Veronica, Barbara, Jamie, and Robin. Like 5 minutes of your time, and then lunch should be here. Oh, lunch
Do
is
you
here.
guys want to break for lunch or do consent agreements? I don't know how many we have.
We have a bunch. I have like 7, I think. We can do them now if you
It's
want to.
up to board. I don't care. Do them now. Let's just get
Do
them
'em.
over with. Okay. Do you mind? Are you ready, Miss Ivory? Okay. We're speedy.
Yeah, at least it's supposed to be coming down. Okay, yeah. It's not up anyway. Lisa will be coming down, but I'm gonna go on and start, because I think we can go through these. Okay. The first one is Andrea Joy Lynch Davis, license number R078359 and also L038171. Okay, on September 25th of 2023, a respondent pled guilty to a Class D felony in possession of controlled substances. Scheduled 1 or 2, 530, 64, 119 in Circuit Court of Grant County, Arkansas. She was sentenced to 36 months of supervised probation and substance abuse treatment and with court costs, fines, and fees on June 2nd of 2025. She was granted discharge of her probation. On October 5th of 2023, respondent self-reported her conviction to the board, and on December 7th of 2023, respondent voluntarily surrendered her license. So she's requesting reinstatement, and she's completed all of her requirements for reinstatement. We consider this to be a A6 violation of 1787-309 and Rules AT. We have her down for probation for 3 years. The course would be substance abuse bundle, 2 AA or support group meetings per week, and no civil penalty because she self-reported. Are there any questions about this one? Okay, I'm gonna go on to the next one. Okay, Lisa DeBoer. She is, let me say that right. Lisa Marie Martis DeBoer. She is Arkansas RN license R107760. We had 2 complaints that prompted an investigation with it. One on July 6th of 2024. We had a complaint that said the respondent failed a drug screen 3 times. The records in the investigation revealed that on November 20th of 2023, the Mercy Hospital in Fort Smith, Arkansas, submitted a complaint indicating a respondent abandoned her patient also. According to the Mercy Hospital, the respondent left the hospital at 1:15 without ensuring proper coverage for her assigned patients, that led to their reassignment among the remaining staff. She did not give report and later was found in the parking lot, citing the need for a break due to rude interactions with colleagues. Despite promising to return, respondent did not come back until later that afternoon. Mercy Hospital asked respondent to leave at 3:58 p.m. due to extended absence and patient care concerns, like uncharted medications and assessments. As a result, the Mercy Fort Smith terminated respondent's travel contract. Also, according to the personnel file from TRS Healthcare, respondent failed 3 pre-employment drug screens on June 11, 2024, June 19th of 2024, and July 1st of 2024. On June 11th of 2024 and June 19th of 2024, respondent's drug screen results reported as invalid for low-creatinine. And then on June 1st of 2024, she had a positive drug screen for meth. So, you probably know that she was on the board, she was on for hearing, and then we pulled her off because she took the consent agreement. We have her on for 1 year, substance abuse bundle, ICRS Righting the Wrong for a course, ethics and professionalism and nursing, and then civil penalty of $2,384 and also therapy. There was a back and forth a little bit with her attorney about the drug screen issue, because she failed 3 drug screens with the dilute, but we didn't have a DNL isomer for the meth. So we came to the conclusion for the 1 year. If she is positive for meth again, of course, she'll become non-compliant, and then we'll put her on for longer. But that's the conclusion we came to. We didn't have a DNL isomer for the meth, so we couldn't confirm what it was for her for the meth. So that was but she technically failed 3 drug screens because of, yeah, that's what she was trying to hide. Yeah. Yeah, yeah. So that's what we were that was the debate a little bit. So that's the conclusion we came to with her. Is there any questions about her, any concerns?
It's TRS Healthcare, and she failed those 3
Yeah.
screens on, I mean, the 11th, the 19th. I mean, they were close. They diluted, yeah.
Yeah, they were diluted. So, but we consider that to be failed anyway, so.
Oh, well, yeah.
Mhm. Well,
This
okay.
one's questionable.
I'll keep my. Okay. Are there any more questions about her? I'm gonna move on to the next one. Okay. Lizzie Ann Jaggers Fort, license number RN 1222779 and license L051707. Oh, I have her on a different sheet, sorry. Okay. The board opened an investigation after receiving a complaint from the director of the Home Health Magnolia Regional Medical Center and the chief nursing officer. They said that the complaint alleged that they spoke with respondent about her court mandated appointment for an evaluation for alternative sentencing program on March 26, 2026. And then the respondent told them that her probation officer had performed a drug screen and that she had tested positive for Adderall, which she did not have a prescription. And then, they told her that she stated to the chief nursing officer that she had gotten the medication for a friend. So the respondent was called into a meeting to discuss that positive drug screen from the probation office, and her employer requested she submit for a for-cause drug screen. The respondent refused to submit the drug screen and turned into her badge. So apparently it happened that they didn't even know that she was in trouble. And so they were wondering about this court mandatory appointment. And so that's what kind of turned into this issue that we have right now. So she was terminated on March 27, 2026, and for the refusal to provide a sample for the for-cause drug screen and quit. So she says that she had another medication and mispronounced it. But then also the pharmacy printouts for the controlled substances from that time frame indicated she was not prescribed any controlled substances. So we have her down for the violation is 1787-309-A6 with the rule 17 CR 126-102 AP. And we put her on probation for 1 year with a substance abuse bundle and $750. She was someone who, so she lives in Colorado right now, and she was working on her multi-state license. This is what, it took so long because she was trying to figure out some kind of way to work. I had to kind of explain to her that with the multi-state license, as soon as you get on a consent agreement or you go before the board, if they do something to you, you can't work because you'll be single stated. And so that's why this came off so late, because she had a hard time accepting that.
I guess my question, why she got a probation officer?
Right.
Where's that in the?
Yeah.
It was, I'd have to her original for that.
I think it was a family
Yeah.
dispute type thing.
But nothing that would
Child
bar.
child custody family dispute.
Yeah.
Yeah.
No, thank you. Okay. Okay, so the next one is Caitlin Joyce Chrisman Goldsboro, LPN license 266691. So an investigation was initiated. We received the complaint on May 11, 2023, in which the respondent was working with Access Medical Center. The respondent accessed private medical records and failed a court-ordered urine drug screen and had a hair follicle test that was positive for meth. We also received additional complaint on June 29th of 2028 regarding respondent's possible drug use. So a little bit of a backstory to kind of make this make sense, because it's also another court issue, is that she was having issues with her husband. I think they were going to a divorce and a custody battle, and that is why we had the court-ordered drug screen. So that's where that's coming from. So what happened was this, is that also the other issue is that she said she provided a drug screen results from Healthy Lifestyle Wellness Center in response to the complaint. However, the board subpoenaed those and spoke with them about that, and it looks like the results appeared to be falsified. So we got a notarized letter that provided a statement that it stated that it has been brought to my attention that the respondent has presented a drug test results with our facility name on it, but that result was not produced from a test that would have been conducted at our office, nor was it tested at the laboratory that we would have sent for testing. So, and I spoke with her about that, and she was like, she couldn't give me a full understanding of how that she had this form and that when I told her the response to that. On March 17th of 2024, we also asked to conduct a professional drug screen, and she refused to submit to the drug screen too. And we have records that on or about August 30th of 2023, the respondent was treated at Lake Point Recovery for meth use disorder moderate. And that was from, I think, from the court records. So that's where we got that from on that. So she is, our suggestion is 2 years, the substance abuse bundle, and 2 support group meetings. Are there any concerns about her?
Did she consent to this? I mean, she refused our pharmacy services. Is she going to do 2 year, you think?
She accepted the consent agreement. I mean, yes, I mean, we'll have to see as time goes.
Yeah.
She was also, it took us a while to get to
Feeling
this
she's
point.
not, she'll fail again on her, she will.
We will see as time. So, okay, we'll see how that goes with her. Okay. Then we have Brittany Yvonne Evans Mayville. She is holder of Arkansas LPN license 122879. On April 1st of 2024, she started a 3-year probation consent agreement. So she has become non-compliant on April 16th of 2026, April 27th of 2026, and May 14th of 2026. She had a positive drug screen for ETG, ETS. On November 10th of 2025, she also had a dilute specimen. So I spoke with her because I was trying to figure out what happened, because she had gone 2 years perfectly fine, and then we had this 3 times of testing positive. Her response was that it was Mother's Day, around Mother's Day, and she wanted to have a glass of wine. I explained to her that this was a consent agreement that was abstinent for everything, because she had a possession charge beforehand. That was the original reason for her original consent agreement that had nothing to do with alcohol. And so I emphasized to her that alcohol is considered to be something that you can become non-compliant for because of this the consent agreement. So we had that discussion with her about that. So we see it as a violation of A6 with underneath the rules AT. We said we have 2 years. She had 1 year left, so we put her for 2 years on the non-compliant one. 3 AA support group meetings per week. She did finish her course before non-compliance, and she was compliant with everything else. But I kind of explained to her that it doesn't matter if you're compliant with everything else, because she kept saying, I'm compliant with everything else. I said, the most important reason why you're here is for these drug screens. So we had to have some concession, talk about that. And she still has $4,383.76 on her civil penalty from her original consent agreement. So I didn't add anything else to this one. Are there any concerns about her? Okay. Okay. The next one is Alexandria Morgan Taylor. She is holder of Arkansas RN license R1073328. She was self-reported she took a friend's medication and tested positive from amphetamines and methamphetamines. As a result, she was offered RNAP. She entered a one-year contract on August 21st of 2025, and she has become non-compliant with her RNAP contract. On September 17th of 2025, she tested a positive drug screen for kind of same thing, amphetamine and methamphetamine. And then on September 30th of 2025, she had a dilute urine a dilute urine drug screen, which is a level 1 violation, which results in a 6-month contract extension. And then on November 20th of 2025, she had a positive urine drug screen for buprenorphine and neurobuprenorphine, which is a level 1 violation. On June 17th of 2026, she had a positive drug screen for ETG-ETS. And then on May 22nd of 2026, she had a positive drug screen for ETG-ETS. So she had her 4-level violations within a 12-month period on May 28th of 2026, which is a level 2 violation. Therefore, she was discharged for noncompliance. For her, we consider this to be a violation of A6 and underneath Rule AT. We put her down for 2 years of probation and also therapy for her, because that was what was originally in her original contract. And so does anybody have any questions about her? Okay. Okay. And so our last person is Crystal Dawn Sajich. Oh, I'm saying that wrong, but Webb. She holds a RN license R079687. It's expired because she voluntarily surrendered her license on she voluntarily surrendered her license. On August 8th of 2024, respondent was sentenced to 3 years in the Department of Corrections Division of Community Corrections and placed on additional SIS for 3 years for 564 419 possession of a controlled substance Schedule 1 and 2 for meth, and ACA 564 443 drug paraphernalia. She, on July 1st of 2025, she completed the terms of her parole. She's a kind of an interesting case for us because she has done excellent since the time period that she went through her, while she was underneath her terms of her parole. I don't know, I put in there her, if you look in there, you'll see that she is actually now, let's see what it's called. Yeah, she's actually a peer recovery support specialist, which she actually works with other nurses in healthcare facilities, working toward helping them go through what she went through. So she has done really well on her recovery, and I also put the letter in there on her receiving that. We put her down for 1 year probation, two support group per week. Therapy, which she's already doing a whole much more than the 2 per week on her therapy, and I mean on her support group and AAs, but also therapy, and then the substance abuse bundle. We consider this to be an A2 and A6 violation with underneath rules AT. We're really hoping that if she does well, she can be a peer support specialist for us, but we'll see how that goes. We'll have to see how she does. Are there any other questions? All right, well, thank you.
Thank you. I do have a motion before the board. I move that the Arkansas State Board of Nursing ratify all of the presented consent agreements today. Do I hear a second?
Second.
All in favor? Any opposed? There are no abstentions. The motion will carry. I think that all of our business is done, so we can recess for lunch. Just a reminder that we do have hearings starting back at 1 p.m. Log out. Everybody log out of YouTube, please. Okay, good afternoon, everybody. The Board of Nursing is now back in session. It is July 8th, 2026, and the time is 1:03 p.m. I would like to just remind everyone that this hearing is being recorded. So if you are going to speak to the group, please make sure to pull the microphone directly in front of you to be heard clearly. And please wait until myself or Mr. Moulton, our hearing officer, have recognized you to speak. We ask that everyone joining us today, please silence all cell phones. And if there are no objections, I will declare a flexible agenda. And with that, I will go ahead and turn it over to our hearing officer for today.
Thank you. Thank you, Madam President. So next item on your agenda, or the first one this afternoon, styled before the Arkansas State Board of Nursing in the matter of Bethany Allison Tosh Dar Collins. NCSBN ID 2021-3899, APRN CNP license number A001-883, PAC number 1777, RN license number R071948. The president already went through the date and the time. I will note for the record the hearing is being held in the offices of the State Board of Nursing, located at 1123 South University, Suite 312, Little Rock, Arkansas. I'm going to go under the assumption that you are Ms. Collins. Is that correct? Okay, could you say that again, ma'am, because I don't think your microphone was on.
Yes, sir.
All right, great. Counsel, would you be so kind as to identify yourself for the record, please?
Yeah, it's Jennifer Ivory, attorney for the board.
Thank you, ma'am. All right, let me go ahead and take judicial notice of the statutes and rules that are governing this proceeding. Ms. Collins, you are here representing yourself this afternoon, correct?
Yes, sir.
All right. And you've read the order of notice of hearing, correct?
Yes, sir.
And you're ready to proceed, is that correct?
Yes, sir.
And have you been in an administrative hearing before?
No, sir.
Okay, so let me explain how the process works, if I might. What's going to happen is counsel's going to go first. She's going to go ahead and call her witnesses. I guess she looks like she has one, okay? She'll go ahead and question that witness. After she's done questioning that witness, because you're representing yourself here this afternoon, you'll have the opportunity to ask that witness questions as well, if you so desire. You don't have to if you don't want to. It's not going to be held against you, but because you are representing yourself, I'm going to give you that opportunity. After you're done questioning, the board may ask questions as well. Once she's done with her presentation, it'll be your turn. You can explain to the board why you're here, what you want. After you're done with your explanation, council may ask you some questions, the board may ask you some questions, okay? After all the questions are done, after all the evidence is in, they stay on the record, but they go into deliberations and they discuss among themselves what they're going to do in terms of the decision. Once they reach a decision, they essentially come back on the record, so to speak, although it's all being recorded, and they announce that with a formal motion and vote, okay? So as the hearing officer, what I do is I run the hearing for the benefit of the board, but it's for your benefit too, and particularly so since you're representing yourself here this afternoon. So if you don't understand what's happening, you don't know what's going on, raise your hand, get my attention, and we'll make certain you do, okay? You get a court reporter right next to you. It's really important for you to give a verbal response to any question that you're asked. If you have a habit, some people do, of giving an aha or nod of the head or something along those lines, I may stop everything and ask you to give a verbal response. I'm not trying to be mean. I'm just trying to make a good record, okay?
Yes, sir.
One witness, what do we got for exhibits? I think I saw it earlier. We've got 5 exhibits. Is that correct for
Yeah.
staff?
That's correct.
Move the admission of those?
Yes, please submit these.
All right, thank you. Ma'am, I have to ask you, since you're representing yourself here this afternoon, do you have any objection to the admission of staff's exhibits 1 through 5? All right, thank you. Without objection, those exhibits are admitted. Ms. Collins, did you bring anything with you
No,
this
sir.
afternoon? Okay, no documents, no letters of reference, anything of that nature?
No, sir.
And you are by yourself, no other witnesses, is that correct?
That's correct.
Okay. Want to waive opening?
I do want to say a short opening.
Please proceed.
Okay. Okay, on June 12th of 2024, respondent entered into a 5-year probation consent agreement with the board. The terms of the consent agreement included, in part, prohibited prescribing of controlled substances for the first year of probation was a board-required appearance to reinstate controlled substance prescribing. On January 13th of 2026, respondents submitted an inquiry regarding the next steps necessary to reinstate her controlled substance prescribing. This hearing is to determine the application of the respondent should be granted by the board to reinstate prescriptive authority with controlled substance prescribing.
Ma'am, she made an opening, but I'm going to ask you to indulge me because it's been my experience that your opening is going to echo exactly what you're going to tell to the board. So you'd just be saying it twice. Is that okay with you?
That's correct.
Okay. All right. Why don't we go ahead and swear in the witnesses, ladies? If you could, would you both raise your right hands? Because I know you're going to be saying something. Do you swear or affirm the testimony about to give in this hearing is going to be the truth, the whole truth, and nothing but the truth?
I do.
Thank you both. Please proceed.
I call Dr. Shannon McKinney.
Shannon McKinney, Assistant Director for Advanced Practice, Arkansas State Board of Nursing.
Okay. Ms. McKinney, as part of your duties, do you review information when an applicant applies for controlled substance prescribing?
Yes, I do.
Okay. So would you please go through the respondent's license history with the board?
Yes. Bethany Allison Collins graduated from Vanderbilt University and for the bachelor's degree in nursing in 2003. Again from Vanderbilt University in 2004 with a master's degree in nursing. She holds national certification from the American Nursing Credentialing Center as a psychiatric mental health nurse practitioner. She was initially certified in June of 2005 with an expiration date of May 27th of 2029. She is the holder of Tennessee RN license number 143872, which is single state and expired on September 30th of 2006. She's the holder of Arkansas RN R071948, single state under active probation, issued by endorsement on September 30th of 2004 and expires on September 30th of 2026. She's the holder of Arkansas APRN CMP license number A001883, also active probation, issued on August 2nd of 2005 and expires on September 30th of 2026. And she's the holder of prescriptive authority certificate number 1777, currently issued on May 20th of 2025 with restricted prescribing to no controlled substances. Ms. Collins has a history with the board who she entered a 2-year probation consent agreement in March 13th of 2008. She entered into a 6-month suspension consent agreement followed by a 4-year probation consent agreement in May of 2010. She voluntarily surrendered her licenses in April of 2014. She entered into a 4-year probation reinstatement consent agreement November of 2018 and is currently serving in a 5-year consent agreement that was issued or ratified on June 12th of 2004. There's no other license or disciplinary history reported in nurses.
Thank you. So this hearing is to determine if the respondent's application for reinstatement of prescriptive authority should be granted. Did you conduct a review and produce a this matter?
I did.
Okay. Is this a copy of the hearing report you prepared?
Yes, it is.
Okay. Did you prepare the hearing report yourself?
I did.
Okay. Please go through your report and your attachments.
Okay. On or about June 12th of 2024, respondent entered in a 5-year probation consent agreement with the Arkansas State Board of Nursing. Terms of the consent agreement included in part prohibited prescribing of controlled substances for the first year of probation with board required appearance to reinstate controlled substance prescribing. On or about May 19th of 2025, respondent submitted an application to reinstate her prescriptive authority. A collaborative practice agreement with Dr. Herman Clements at Trinity Mental Health was submitted. Controlled substance prescribing was not included. The collaborative practice agreement was approved by ASBN staff on May 20th of 2025. On or about January 13th of 2026, respondent submitted an inquiry regarding next steps to reinstate controlled substance prescribing. Respondent was instructed to submit the following documents: an updated collaborative practice agreement and quality assurance plan that includes controlled substance prescribing, 5 hours of pharmacology continuing education, including the 2 ASBN mandatory courses, and any other evidence to support the respondent's ability to prescribe controlled substances safely. On May 5th or May 7th of 2026, the respondent submitted an updated collaborative practice agreement with Dr. Herman Clements that includes prescribing in Schedules 2 through 5, which would also include Schedule 2 stimulant prescribing. She provided a personal letter in Attachment 27. In Attachments 28 through 37, she provided pharmacology CE, which included a total of 22 hours of pharmacology continuing education. And Attachment 38 is a letter of recommendation from a licensed social worker, Natasha Kosalis. And that concludes my report.
Okay. Has respondent, to your knowledge, has the respondent been compliant with the other stipulations of her consent agreement?
Yes, she completed required courses, and then she's complied with all monitoring check-ins and drug screens and has not had positive specimens. I conferred with a monitoring staff to make sure that she had been compliant with her probation when she initially put in the request, and then also confirmed recently that she has continued to remain compliant.
Do you have any other concerns with the respondent?
I do not. We have already been monitoring the respondent's prescribing practices through the prescription drug monitoring program, there have not been any since she's not prescribing controlled substances. So she has complied with that, and we will continue to monitor her prescribing habits if she's reinstated.
No further questions.
Thank you, Ms. Ivory. Ms. Collins, do you have any questions for this witness?
I don't have any questions.
All right, thank you, ma'am. Board members, any questions? Apparently not. Ms. Ivory, do you rest?
Yes.
All right. Ms. Collins, your turn.
Okay.
So go ahead and explain to the board why I guess you want your ability to prescribe again and the circumstances. And after you're done, Ms. Ivory may ask you some questions, and my guess is will too. Go ahead, ma'am.
Okay, so as she said, I did enter a probationary period on June 12th of 2024. I did wait. I know it told me I could have a year, but I did wait another year to just confirm what I'm doing for myself, and just to get more of the stability within my life and within my personal life before I took on such a challenge. But I am here today asking you that if I could have my DEA licensure reinstated. And that is all I have to say.
All right. Thank you, ma'am. Ms. Ivory, any questions?
No.
Board members, any questions?
The role, like where you're working at currently, and like what will add to, I mean, obviously you can prescribe controlled substances and you're a psych mental health nurse practitioner, but kind of like what kind of clinic is it? What do you see on average?
I am actually an owner of the clinic as well as a practitioner. Currently I am seeing probably about 700 patients. I believe it will add somewhat. There is a role for narcotics in practice, but I have over the last few years learned how to prescribe without using that, and to use therapy as well, even though it will add some. Like I said, there is a role for it, but it is a temporary role. I have basically practiced and resumed my practice as therapy should be more important than the narcotics, and they should only be used on a temporary basis. However, we do have patients who come in already on astronomical amounts of narcotics, which I am trying to get these patients to understand and educate them in therapy ways and behavioral modifications over their just taking medication to resolve an issue.
So do you see more like children or adults, or a combo of all of the above?
It's a good mixture of both.
Okay. And when you say narcotics, do you mean more like controlled substances, like a benzo, or is that what you're meaning? Are you doing opioids for?
No, I do not use opioids in my practice at all. It is more of like Schedule 2s for the children, for ADHD medications, and then we do have some benzodiazepines.
Okay. One more questions. So your collaborating physician, does he work like on site with you, or like at a different, like how often is he?
He comes in, he sees our patients once He comes in every Thursday.
Okay.
And then he sees patients that need their like first and 6th month for the Schedule IIs. He also reviews a lot of my charts. I put them in for review probably more than I should, but he does review all of our charts as well.
Okay, thanks.
Any other board members? All right, based on that question from the board or questions from the board, any follow-up, Ms. Ivory?
No, thank you.
All right. Ma'am, anything else you want to add?
And just thank you for the opportunity to be here today.
All right, thank you so much, ma'am. Any rebuttal, Ms. Ivory?
No,
All right, how about a closing statement or any?
no closing.
All right.
No.
Shot, anything else you'd like to add, Ms. Collins? Okay.
No, sir.
It's just procedure. I've got to go through the process. All right, with that, I'll go ahead and state that the evidence and testimony is completed in this matter. I will go ahead and turn it over to the president and board for deliberations and motion and a vote. Madam President?
With that, the board is now in deliberations. Comments, questions? I mean, I think the findings of fact are pretty clear, timeline's pretty clear. Do I hear a motion? Is this just a? Okay, we'll just do a freehand, which I can actually probably do up here if y'all want. I'm sorry, what? Yep. So it'd just be a unencumbered reinstatement of authority? Okay, just the ability to prescribe. Just normal prescriptive authority, does that cover all the, is that the right language?
Control
Controlled
substances.
Controlled substance prescribing, Schedule 2 through 5. Do you mean right or you right?
It's okay, I can write it. Just say that again.
Controlled substance prescribing, Schedule 2 through 5, including Schedule 2 stimulants. And then she will apply for her DEA on.
Sure, that's independent of us, yeah. Did you read that from somewhere? Is that in the order of notice? Is that?
Well, just
Surely it should.
back on submitted. Respondent requested controlled substance prescribing in Schedule 2 through 5.
Okay, 2 through 5. There's no penalties or anything for this, right? Because there's no additional, okay. Okay, we do have a motion before the board. I'll actually wait till it's in front of me so that I'm reading it and not just speaking so you guys can check me. Since it is a write-in, the motion before the board is that the respondent's controlled substance prescriptive authority for Schedules 2 through 5 be reinstated. All in favor? Any opposed? There are no abstentions. The motion will carry. The board is now out of deliberations. Let the record reflect that it is 1:22 p.m. on July 8th, 2026, and that our respondent is present in the boardroom. There is a motion before the board. I move that Bethany Allison Tosh Dar Collins, A001883, PAC 1777, and R071948, have her controlled substance prescriptive authority for schedules 2 through 5 medications to be reinstated. Signed by Jamie Sims, seconded by Philip Petty. All in favor? Any opposed? There are no abstentions. The motion will carry. I'm going to turn it over for more things, but we wish you the best of luck.
We're going to go ahead and mark as Exhibit 6 the board's motion decision that's been memorialized and admit that into evidence. Ms. Collins, since you prevailed, there's a couple of housekeeping matters. One is I'm going to instruct we're going to make a copy of that and get you a copy of it before you leave. But I'm also going to request that the board further reduce the decision of the decision of the board to a more formal document. Get a copy of that to you. It's going to have an information sheet or a cover letter that notifies you of your appeal rights. I know it seems odd because you won and you got what you want, but they've got to do that under the law. And sometimes the law is a little odd. So if you see that, don't get alarmed. That doesn't mean anything. They're just crossing the T's and dotting the I's, okay? However, if you do want to appeal, you get 30 days in which to do that.
I think
And
I'm
you can
good.
appeal in the county where you live or Pulaski County. Do you have any questions or anything else you'd like to state to the board one way or the other?
I don't know if I can. Thank you. It's been a long road. And so thank you. I appreciate it. I appreciate the opportunity.
Yep. Do you have any water with you, man?
No.
Okay. Maybe we'll try to get you some before you leave. All right. Anything else on the board on this? If not, I'll call this hearing to a close.
Good luck.
Thank you.
Miss Lisa is the next respondent here. We have Hinkle and James. Okay, so we're going to go to James. Okay.
Yeah. I was like, if I don't do it right now, the second I'll forget. Okay.
Good afternoon. The Board of Nursing is now back in session, and I am just wanting to send a couple of reminders for everyone to be aware that this hearing is being recorded. So if you are speaking, please pull the microphone directly in front of you and wait until you've been recognized to speak. And we ask that anyone that is joining us to please silence their cell phones. With that, I'm going to turn it over to our hearing officer, Mr. Moulton.
Thank you, Madam President. Just for the record, it is 1:30 in the afternoon of Wednesday, July 8th, 2026. This hearing is being held in the offices of the Arkansas State Board of Nursing located at 1123 South University, Suite 312, Little Rock, Arkansas. Next item on your agenda this afternoon, style before the Arkansas State Board of Nursing in the matter of Kennedy Taylor Holt James, NCSBN ID 234-77052, APRN CNP license number 226561 inactive, and RN license number R106042 inactive. I take it you were Ms. James, is that correct? Ms. James, could you go ahead and say that again?
Yes, sir.
All right. And you are representing yourself here this afternoon, is that right?
Yes, sir.
And you've read the order of notice of hearing, correct?
Yes, sir.
And you're ready to proceed this afternoon, correct?
Yes, sir.
Okay. Mr. Dawson, would you be so kind as to identify yourself for the record, please?
Yes, David Dawson,
All right. I'm going to go ahead and take judicial notice of the statutes and the rules that are governing this hearing. Ms. James, have you ever been an administrator before?
No, sir.
Okay. So let me explain how the process works. I'm the hearing officer, which means I run the hearing. I don't make the decision. The people to my left and the people to my right are the ones that are making the decisions. I just run the hearing for their benefit, but it's for your benefit too, okay?
Yes, sir.
So as we go through this process, if you don't understand what's going on, you get a question, raise your hand, get my attention. I want to make certain you get a fair shake in front of this tribunal and you get your story fully told, all right?
Yes, sir.
And if you don't think that's happening, I'm not doing my job, okay?
Okay.
What's going to happen is that Mr. Dawson's going to go first because he has what's called the burden of proving the allegations that are contained in that order and notice of hearing that you read. It looks like he's got one witness that he's going to call. He'll ask that witness questions. After he's done asking that witness questions, and he'll also introduce some exhibits as well, or try to. After he is done with that examination of that witness, because you're representing yourself here this afternoon, you will have an opportunity to ask that witness questions too. If you don't want to ask questions, it's fine. It's not going to be held against you, but I'm going to give you that opportunity because you're representing yourself.
Yes, sir.
Once he's done, he rests. It'll be your turn to tell your side of the story to the board. It's really helpful if you have the order and notice of hearing in front of you, because you can either say, I agree with these things, or I don't agree with these things, and why, okay? After you're done with your explanation, Mr. Dawson will probably ask you some questions. The board will probably ask you some questions too. Once all the testimony's in, once all the evidence is in, they go into deliberations and they discuss amongst themselves what it is they decide to do. And once they make that decision, they come back, they formally announce it with a motion and vote and a decision, okay?
Yes, sir.
Does that make sense to you?
Yes, sir.
It's really important to give a verbal response to every question that you're asked. I get a court reporter that's sitting right next to you, so he's transcribing. There are some people that have a habit of giving a nonverbal response to questions. They nod their head or something. If you do that, I may stop things and remind you to give a verbal response. I'm not trying to be mean or you know, put it on you one way or the other. I'm just trying to get a good record, okay?
Okay, yes, sir.
All right. Any questions for me?
No, sir.
Okay. Mr. Dawson, you've got, oh, let me ask you, Ms. James, is it just yourself here this afternoon?
Yes, sir.
Okay, no character witnesses, nobody with you?
No, sir.
Okay. Mr. Dawson, you've got 5 exhibits, is that right?
Yes.
All right. I see one witness, but it looks like there's 2 of them listed.
Yeah, the second witness is only if the board has any additional questions
Okay,
about
all
the
right.
alternative program.
So I assume we're going with the first witness on this list?
Yes.
Okay, all right. Ms. James, you didn't bring, I already asked you in terms of, you're just by yourself, right?
Yes, sir.
Okay. You seem a little soft-spoken, and I understand why that is. I know this is a little intimidating, but if you would be so kind as to speak up as much as you possibly can so people can hear you, we'll probably pull that microphone a little bit closer to you too.
Okay. Can you hear me?
That's much
Okay.
better. Perfect. All right. Mr. Dawson, how about move the admission of exhibits 1 through 5?
Yes, just for the record, those exhibits are the order and notice of hearing, the Nurse Practice Act, the rules of the board, the Postal Service report, service of notice for today's hearing, and Lisa Wooten's hearing report with attachments. Thank
All
you.
right, thank you. Ms. James, because you're representing yourself, I have to ask you, do you have any objection to the admission of staff's exhibits 1 through 5?
No, sir.
All right, thank you very much. Without objection, staff's exhibits 1 through 5 are admitted. Ms. James, did you bring any documents with you this afternoon that aren't part of what already has been introduced that you would like the board to see?
No, sir.
Okay, just you. Let's go ahead and swear in the witnesses. Ladies, if you could, just go ahead and raise your right hands. Ms. James, you have to do it too, because you're going to be
Sorry.
testifying.
Oh,
Sorry.
okay.
That's fine. Do you swear or affirm the testimony you're about to give in this hearing is going to be the truth, the whole truth, and nothing but the truth?
I did. Yes, sir.
Thank you both very much. Mr. Dawson, do you want to waive an opening?
I want to make a
A
brief one just to explain. This one's a little different.
Not a problem. Please proceed.
What happened basically in this case was you'll hear from the evidence that Miss James was offered RNAP after testing positive at work for marijuana, and so she entered the RNAP program, but she was not successful. She had some violations, and so under the terms of the RNAP contract, she was offered a consent agreement that matched the terms of the RNAP agreement. And that consent agreement was presented to the board, I can't remember which month, a month or two ago, but the board was not comfortable with ratifying the agreement at that time and requested that Ms. James appear before the board so they can consider, speak with her in person and consider whether or not to ratify a probation agreement. So that's why this hearing is scheduled today. It's basically the board is to consider the violation of the Nurse Practice Act would be the non-compliance with the RNAP contract.
All right, thank you, Mr. Dawson. Ms. James, because he's done an opening, theoretically, you have the opportunity to do one too. And I'll give you that opportunity if you'd like. However, it's been my experience that your opening is going to mirror exactly what you're going to tell the board. So when it's your turn to tell your side of the story, so you'd just be saying it twice. Is it okay with you if you waive your opening?
Yes, sir.
All right, thank you. Mr. Dawson, how about your first witness, please?
Thank you. I'll call Lisa Wooten.
Lisa Wooten, Assistant Director, Arkansas State Board of Nursing.
Ms. Wooten, would you please go through the respondent's license history?
Yes. Kennedy Taylor Holt James graduated in 2017 from the University of Arkansas in Little Rock with an associate degree in nursing. On May the 11th, 2019, she graduated with her baccalaureate degree from the University of Arkansas at Little Rock. And in July of 2023, she earned her master's degree in nursing from Chamberlain University. Her licensure includes Arkansas RN Single State License R106042, issued by exam on 1/23/2018, and it expired on May 27th, 2026. She also been issued APRN CMP License 226561 by exam on November 16th, 2023, and it expired on January 23rd, 2025. She also has been issued a Prescriptive Authority Certificate 145, 14351, issued on December the 11th, 2023, and it expired on 1/23/2025. She has no previous discipline or license history reported in nurses.
Thank you. Is the hearing, has it been scheduled today to consider noncompliance with the RNAP agreement and the board's instruction that they wanted to speak with the respondent in person?
Correct, yes.
Okay, and did you produce a report that outlines the information with regard to the entry into RNAP and the noncompliance with RNAP?
I did. It's dated May 21st, 2026.
Thank you. If you would, please go through that report and give the board an idea of what the, remind them what the background is.
Okay. If you'll refer to attachments 1 through 4 on January 7th, 2025, the Arkansas State Board of Nursing received a complaint from Sandra Evans at Baptist Health in North Little Rock, Arkansas, regarding respondent's practice. The report indicates the following. Respondent was reported as acting impaired during an emergency situation on labor and delivery. On December 23rd, 2024, at approximately 18:30 in the labor and delivery operating room, a patient suffered significant blood loss due to a uterine artery rupture. Respondent was unable to perform duties as a nurse proficiently and professionally. She was unable to follow commands. The OR was filled with a strong marijuana smell with her presence, and her responses were delayed. She could barely keep her eyes open and lost balance and fell forward into the patient's bed. Respondent was unaware and left the room when the patient had change in consciousness and blood pressure fell to 68/36. Other staff at the bedside, RN Carnation, CRNA Rochelle, complainant, and Dr. Cockrum assisted with the mass transfusion. Dr. Cockrum stated in part she did not want respondent to care for her patient. During the escort to the lab for a for-cause drug screen by Carmela, respondent admitted she would test positive for marijuana. Respondent was suspended and sent home pending the results of the urine drug screen. The urine drug screen was positive for THC at 1,136 nanograms in ml, and respondent was terminated. That's attachment 5 through 6. If you'll refer to attachment 7 through 8 on January 19th, 2025, respondent was referred to the Arkansas Nurse Alternative Program. Respondent signed the RNAP agreement and acknowledged violation of the Arkansas Nurse Practice Act, ACA 1787 30986, which states in part is guilty of unprofessional conduct, and ASBN Rule 17 CAR Section 126-102 8P, which states unprofessional conduct includes failing or refusing a drug screen as requested by employer or board. ASBN requested respondent obtain an evaluation for addictive behavior by a board-approved evaluator within 30 days of signing the agreement. If you'll refer to attachments 9 through 23 on May 10th, 2025, respondent entered into an 18-month contract. She became non-compliant with RNAP contract as follows. July 28th, 2025, positive UDS for THCA at 9 nanograms in ml, a level 1 violation. November 19th, 2025, positive urinary drug screen for ETG at 807 nanograms in ml and ETS at 52 nanograms in ml, a level 1 violation. ETG and ETS are the metabolites of alcohol. February 3rd, 2026, positive urine drug screen for THCA at 7 nanograms in ml. March 5th, 2026, positive urine drug screen for THCA at 8 nanograms in ml, a level 1 violation. March 19th, 2026, positive urine drug screen for THCA at 20 nanograms in ml, a level 1 violation. If you'll refer to attachments 24 and 26, respondent was discharged from the program on March 26, 2026 for noncompliance due to 4 level 1 violations within a 12-month period. If you'll refer to attachments 27 through 50, respondent was offered a noncompliance consent agreement for probation for 18 months as required in the RNAP contract, section 17 to discharge from RNAP. She was also given the opportunity to voluntarily surrender her license. The offered consent agreement was sent by USPS certified mail and through the ASBN nurse portal. Respondent signed for the certified mail on April 23rd, 2026 and viewed the message sent through the portal on April 9th, 2026 at 1:46 p.m. and on April 23rd, 2026 at 10:04 a.m. On June 4th, 2026, respondent agreed to the consent agreement offered ASBN staff presented the consent agreement before the board for ratification. The board failed to ratify the consent agreement and request a respondent appear before the board. And that concludes my report.
Okay, so her non-compliance issues primarily were consistent with the reason why she was referred to the RNAP contract to begin with, the testing positive for marijuana.
Yes.
And the RNAP contract, if you look on page 35 of your attachment, it says it's for 18 months. Does that match what this is the consent agreement. I may have said RNAP contract. I'm sorry. The consent agreement matched the terms of the RNAP contract.
Yes, both are for 18 months.
Okay. Thank you. That's all the questions I have.
Thank you, Mr. Dawson. Ms. James, would you like to ask the witness any questions?
No, sir.
Okay. Members, any questions for the Assistant Director? All right, Mr. Dawson? Any other witnesses?
No.
Do you rest, sir?
Yes, sir.
Ms. James, it's your turn.
Yes.
Go ahead and tell the board what transpired if you could. And then once you're done with your explanation, Mr. Dawson will probably ask you some questions and the board members will probably ask you some questions too.
Yes, sir.
Go ahead, ma'am. And if you don't want to give a statement, that's fine too. Mr. Dawson may just ask you some questions. It's your prerogative. What would you like to do?
All of those things? All of those things?
I'm sorry, Ms. James, I didn't hear you. Go
All of those things?
Well, that's fine. They're probably going to all happen, but I just was curious as to whether or not you wanted to make a statement. Do you want to make one?
Yes, I want to make a statement. I was non-compliant with the RNAP program. Around the time that I was placed on the RNAP program, I was diagnosed with bipolar disorder, and I found out that I was having a manic episode at the time when I was working at the hospital. And when I talked to the doctor about it, he told me that he thinks it stemmed from the domestic violence that I was undergoing at home. So around that time, I became homeless and I was by myself. And I have 2 children that I take care of. And through the course of the RNAP program, my noncompliance started with a Delta 8 pen that I didn't know would test positive for marijuana. And I just used it to help for whenever he beat me because it made me feel better. I ended up I had to call the police because he just did some things that I ended up having to call the police for. So I was kicked out of my home with my children. And that was in the middle of the RNAP program. That was around October. And I've been trying to we've been couch hopping and stuff to find somewhere to stay. And I finally did find somewhere to stay with my children. But during that time, I also had a miscarriage, so I couldn't continue taking my bipolar medications. And so I was kind of struggling to both afford them, and then I couldn't take them. I don't plan on being non-compliant anymore. I've been seeing my psychiatrist, and they've been adjusting my medication since my miscarriage. And I'm really nervous, so I really don't know what else to tell you guys. I had more that I wanted to say, and now I can't think of everything that I wanted to say. But I'm not in that situation anymore. There's a no contact order, and I'm currently getting divorced. But we graduated nursing school together, had been together ever since, but it was a lot of manipulation and forcing me to do things. He forced me to go to nurse practitioner school when I didn't want to be a nurse practitioner. I wanted to be a labor and delivery nurse.
Why don't I do this, if it's okay with you, ma'am? I'll go ahead and have Mr. Dawson ask you some questions, and then we'll turn you over to the board, and they'll probably ask you some questions too. Is that all right?
Yes, sir.
All right. Mr. Dawson, any questions?
Yes. Would you explain a little bit more detail, what your current treatment is for the bipolar disorder?
I was taking Abilify 15 milligrams nightly, and I spoke to the psychiatrist. I did have an appointment with him today. He switched me to Latuda, so I should be starting Latuda very soon.
And how long have you been doing this? Seeing the psychiatrist and all?
I saw a psychiatrist before before that incident at the hospital. I started seeing Kizzy Houston. She's a nurse practitioner at the R Care Clinic on Canis. I was seeing her before I got diagnosed with bipolar disorder, and she had me taking Lamictal. So I was taking Lamictal for a little bit, but she said that maybe the Lamictal wasn't strong enough, and because I had that domestic incident, it triggered a manic episode because I didn't sleep for like 20 days.
The board is going to be concerned with patient safety. So I know this gets a little personal, but when you have a manic episode, or some people act in different ways, do you get violent, or
No,
what
sir.
kind of reaction do you have?
It was more of depression. It was more of depression and not really being aware of kind of where I was sometimes. And I would forget things. And my mom would say, she was just like, you're staying up and it's like I'm talking to you and you're responding, but it's like you're not there.
When you were, the original incident at the hospital that happened before you were offered the RNAP program, is that what was happening there?
Yes, so around that time, that was in January, I had to, because of the domestic stuff, I moved out and I stayed kind of with cousins, kind of hopping around and stuff before that happened, a couple months before that happened.
And on that particular day, was your behavior,
So on that
you
particular,
had used marijuana ahead of time because you tested positive at a pretty high amount?
so that was the thing, I actually didn't use marijuana before I went into work. Where I stayed just smelled like it because of the people that I lived with. I had used before, but I never really used before work. It was more, I only used for like, Tylenol wasn't good enough sometimes for like the bruises and stuff. And so that's what I had turned to help with the pain.
So the description from the facility was that you were appearing impaired and not paying attention. Do you attribute that to the marijuana or to the bipolar disorder?
It was more for the bipolar. I didn't use marijuana before I went into work, but whenever I talked to the state board after that incident happened, they told me I could either fight it or do the RNAP program. And because I didn't feel like I could fight it with them, that's why I did the RNAP program. In that situation, I actually never even got report on that patient in the ER. As soon as I came in, they told me to go in and help in the ER, but I never got report on that patient. So that patient wasn't my patient yet.
So after you did the RNAP program, you tested positive, continued to test positive for marijuana. And I think that's the reason that the board's concerned, plus that you are a nurse practitioner. And so you just said that you were not
I don't plan on working.
planning
as a
on
nurse
working. So would you explain that?
Yeah, I didn't. I never wanted to be a nurse practitioner. He wanted me to be in school. He made me do all of that. I didn't want to be one.
The board may, if the board restricts your ability to practice as a nurse practitioner, but allows you under monitoring to practice as a registered nurse, are you okay with that? Or do you
Yes.
want to keep the nurse practitioner license? I'm not asking you to completely voluntary surrender it right now. I'm talking about it maybe a temporary suspension.
Right now, I'm a single mom of 2 kids. But when I worked as a nurse practitioner, all the homework that I had to do, I couldn't do it with my 2 little kids. I worked as a nurse practitioner for a year at R Care, and it was hard for me to keep up with everything. And so it wasn't what I wanted to do, but I did enjoy helping the patients that I did help, but it wasn't what I wanted to do.
Okay, so maybe in the future, if your life hopefully improves.
If my kids get older, I might consider.
You
going
might
back
consider it in the
and
future.
doing it again.
Okay. If you would, since it was the same issue, kind of seemed to revolve around marijuana, I mean, you did agree that you did not comply with the RNAP contract, right?
Yes, sir. I actually didn't know that the Delta 8 pens would make me test positive for marijuana when I bought it from the gas station. I didn't know that
Well,
it actually would make me test positive for THC.
Right.
And it was like, by the time I started testing positive in the program on it, I didn't know.
Well, you tested positive for alcohol once and you were told when you started you weren't supposed to drink alcohol, right?
The alcohol was actually an accident. It was the day after. It was my birthday and my sister had bought me a drink and I didn't know that it had alcohol in it. So they drug tested me the very next day on the 23rd and my birthday was on the 22nd. So that was an accident.
Well, the reason I was asking those questions is basically if you would give a better, a little more detailed explanation to the board of why they're not going to, if they allow you to continue to practice, I'm sure it's going to be under a probation agreement or a
Understand.
probation order. What can you say to assure them that you're going to comply with the monitoring terms of that and all the other terms of that order?
I have to comply. That's the only way I can take care of my children. Like I have to comply. I don't want to. I'm not in that situation anymore where I'm getting hurt or anything. I'm in a better place. I'm not at the homeless shelter anymore. I've got my own place to stay. I'm not around that anymore.
What's your plan for your continued mental health
I
care?
see doctor only every 1 to 3 months. And so I've been continuing to see him and he talks to me and I've been complying with my medication. He's helped me find a way to get my medication for free. And so they mail it to me now. And so I haven't had any problems with it. I haven't had any more manic episodes.
Okay, so you have been seeing this physician regularly?
Yes, and he's the same physician listed on my RNL program.
Okay. I'm sure the board will have some questions. Thank you.
Yes, sir.
Thank you, Mr. Dawson. Board members, any questions?
Good afternoon.
Hey, so, part of our concern was kind of what Mr. Dawson brought up, that you have a nurse practitioner license that you could reactivate, and then also this RN license. And I was kind of confused on why you hadn't practiced really very long as a nurse practitioner and then went back to RN. So you explained that. So thank you for that. So kind of going back right now, your RN license is expired or has been expired since March, right?
Yes, sir. Yes, ma'am.
What have you been doing recently?
What I didn't know it was expired. I thought they inactivated it after I was discharged from RNAP. They inactivated it, but I thought I renewed my license.
Maybe I'm looking at that.
You're right.
This, notice it's an odd day, it's like 57.
Yeah.
So until they get on the monitoring, you don't
Fired. So
they show them expired.
at that point, okay. So have you been working or?
I was working at All Springs Rehabilitation Center a little bit before I was discharged from RNAP.
Okay. And then are you working anywhere currently? And
I have 3 jobs right now. DoorDash, I work at Starbucks, and then I'm a home health care aide.
Okay. So doing that. And what is your plan? Because you said labor and delivery was your love, and typically on an RNAP contract or a consent agreement, we don't do labor and delivery, ER, those kind of high risk areas. So are you okay?
And that's fine. I actually have enjoyed doing nursing care at the nursing home. It's actually been it's actually been an eye opener. I learned a lot in nurse practitioner school about geriatric health, and it's actually been I've loved it. I've loved taking care of the older residents also.
Kind of a different change of pace.
Yes. And I would like to go back to labor and delivery in the future, but I also I like the hours and I like seeing the same patient over and over again when I work in nursing care at the rehab. And just kind of talking to those people because they don't get a lot of family and stuff that comes to visit them. So I actually like it too. I've learned to like it.
That's good. So that was one of my questions. Would you be compliant? Because what we don't want to do is, go back and then we're non-compliant. So, when Mr. Dawson is telling you that, it is a 0 tolerance policy. So,
Yes, ma'am.
double checking medicines, double checking vitamins, all
Yes, ma'am.
those things. And then just being very good about continuing with your continuity of care for your psych mental health too. And so I'm glad you're in a much more stable environment. And that really explains a lot of what was going on in your life at that point, because that's sometimes what we don't get to see. So it was really probably me that was pushing to see you here today because it made me a little nervous. Because our
Yes, ma'am.
job is to protect the public. But we
I
want you in a
understand that.
good mental capacity to do that as well. So, you know, I want you to be back at work, but I think we're going to have to do some type of drug screening to prove that we're in a good spot.
Yes, ma'am.
Which hopefully you will pass with flying colors and
Yes, ma'am.
we can reinstate you back fully. So.
Yes, ma'am.
Good afternoon. I just have a couple of questions. Are you currently or do you still use any THC products?
No, ma'am.
I think your the evaluation that was submitted to us, it was noted that you either stated or at least the evaluator was under the impression that you had stopped use of such at that time. And I think that you had at least 4 positives for THC. So when did you stop using THC?
Around the time I was discharged from RNAP, it was around that time. So maybe May-ish.
You haven't used
May,
any
April.
since then?
No, ma'am.
Okay. And I think, you know, I understand life's really hard and stressful, and it sounds like, you know, you've had some really terrible experiences and
But it wasn't, I'm not trying to use it as an excuse. I know I messed up and I shouldn't have. It was
You
just
feel
that
like-
that was my go-to whenever that happened to me. That was my go-to too. And I just had to stop doing that and get on medication. I have a family history of bipolar disorder, but none of my siblings were ever diagnosed. I was the first one to be diagnosed with it.
what kind of support system do you have that you can rely on so that you don't fall back into using this as
My mom, after she found out, because I hid it from people what was happening to me, and once she found out, she was able to help me and get me from Dorcas' house. So she's been my support system, and she's been helping me with my kids. So she just didn't. He wouldn't let her help me at first. So he cut me off from a lot of my family, and I never wanted to be a nurse practitioner. I couldn't go to my graduation or anything. And I was happy being a labor and delivery nurse before I met him. Like, I really was. And everything it just seemed like after that, then it's like I couldn't sleep anymore. And that's kind of when the bipolar disorder kind of made its appearance at the time when I was going through those things with him.
and who do you see for your current prescriptions?
Dr. Ronald only.
And how often do you see him?
I see him every 1 to 3 months.
Thank you.
Any other board members? Follow up, Mr. Lawson?
No. No.
Ma'am, anything else, Ms. James, anything else you'd like to add or state?
I'm just glad in a place where I don't have to be in that situation anymore. And I don't see non-compliance being an issue in the future because I'm on my medications and I'm not in that environment anymore. Me and my kids are not there anymore. I've got us our own place to stay and stuff. And I have support when I didn't have support at first because I hadn't seen my family in years because of the situation with that.
All right, thank you, ma'am. Mr. Dawson, how about a closing statement?
I'll waive closing.
All right. I'll go ahead and call the evidence and testimony to a close. I'll turn it over to the board for deliberations, motion, and vote. Madam President?
The board is now in deliberations. I think you guys have a findings of fact in front of you, just real quick to kind of refresh on the dates. So the RNAP was entered into in April of 25 for 18 months, and then she was discharged about, 11 months later? 5 THC positive, and then I think 1 alcohol positive in that time. This event was in December of 2024. Go ahead, move your mic down, sorry.
So I kind of have a little different perspective on this one. So two pieces of this. I think one, I'm a little bit concerned the use and then also just mental health, but we also have this nurse practitioner license. So it's just a thought out here for a motion of like 12 months, 12 months on probation, but hold like not on the RN license. Can we hold that on the APRN?
And then you would,
And then at the 12 months, she could apply for to reactivate her RN license, her APRN license if she had been fully compliant.
she's going to be working as an RN. Wouldn't you put the
Only.
probation on the RN license?
Yeah, that's what I'm saying.
Oh,
Yes, but-
sorry. Okay.
Yeah, so I'm putting
Yes.
the probation on the RN license. I'm not allowing the APRN license to be activated for 12 months. at
I think
all.
that's, yeah.
But then when she's done and if she's fully compliant, and she may not want to reactivate her APRN license, but she could. But then we'd
Yeah.
also know that we're mental health is a stability, and then also drug is compliant.
You and Jason maybe are, I think I'm kind of directing this question to y'all, but do y'all feel like 12 months is an appropriate amount of time to be monitored
Do we need
for
to do
relapse or?
18 though, because that was her RNAP contract. And
Oh,
the
yeah, you
RNAP
can't do anything
contract
less.
States if you get a similar,
You can't do anything less. You can have more, but you can't have anything less.
My thought on
Is that-
I was with you on 18 months, but my thought was a lot of times we would allow them immediately to get their APRN license,
right?
but we're holding that from her, so I was
Well,
trying
you
to,
could do 18 and she could kind of like we do the prescriptive authority thing, like say
12 months in.
Yeah, you could 12 months into the probation, if you're being compliant, you can apply for APRN. I don't know that she'll choose to do that, but if she did, it's available to her to do that after a year. I agree with that. I think that's a good idea. I just think we might get into something sticky if we don't stick with that RNAP contract the way it.
So Ashley just reminded me
Yeah.
that that's the board's, that's like a standing directive for staff cannot offer anything less
Gotcha.
than
We can do different.
whatever we
Well,
need.
I'm good
or
with whatever.
Thanks, yeah.
I just didn't want us to get.
Just a lot of times we see, obviously they have an RN license if they have an APRN license, and we allow them to reactivate,
Sure.
simultaneously. I think on this situation, I have a little bit of heartburn simultaneously doing that, and not that she's going to practice, but if we, that she could, so.
I think that's great.
So I think that's kind of why I was backing down to 12
I'm good
months,
with that.
just be good with
12
that.
months is good. 12, 12, I believe too.
And I'm glad too, she has a plan outside of some of those restricted areas.
Yes.
Or thoughts of a plan. I mean, you gotta get a job and do all that, but that there's other options out there. It's good.
It's not home health, right? It's like a facility.
Yes.
Long term, okay.
Yeah.
I don't know that I
Long-term
caught
care.
exactly where she was working. Okay, do I hear a motion? And then while we're pulling one up, any courses that anybody thinks might be helpful?
She complete.
Yeah, with substance abuse and something else, I found it.
She said she has not. Has not, okay. So I think we could just continue those, yeah.
So will this be a write?
Yeah, just whatever RNAP.
Write in the one line about the APRN license on an.
I think you can do a probation and we could probably write it into system.
Okay. Cassie, I think I've actually got it.
Okay.
Yeah, actually, if you don't mind, and then that way we can kind of keep going down the list here. So what I'm hearing so far is a 12-month or a 1-year probation on her RN license. I believe there will be a civil penalty associated. There'll be the $750, and then was there a third party investigation that we need to? Okay. So it'll just be $750, is that right? Civil penalty?
Yes.
Okay. And then, do we want to reassign those courses? You said that they haven't been completed?
Correct, I think just reassign the courses, yeah.
Same ones?
Mhm.
Was it just the substance abuse bundle?
I
Trying to
think so.
find it. It's in a different place in the RNAP contract. You know, I'm looking over here,
I'm also looking too.
all the medication, touch screen.
She said it's
Nice.
2 courses.
The nurse and professional behaviors, yeah. Those two are listed there.
Is everybody comfortable with those two?
Mhm.
Take away, add anything? Okay. And then we obviously don't need another evaluation. We could just do, maybe check the counseling to either obtain or continue counseling per
Our position.
yeah, physician recommendations. And then is everyone okay with reinstatement without an appearance?
Yeah.
And then there won't be any changes to the standard stipulations. We'll just add maybe a line up top, Tabby. Whenever you're ready, we'll add something about the.
Yeah.
Mm-hmm.
So.
You mean the APRN? So the APRN license will remain suspended? Is that the right language, or just inactive?
It's not suspended currently, so you're gonna have to.
It's just we've not renewed it, right? Is that what it is?
No,
What's the right language?
They're inactivated right now because of.
Okay, so just will remain inactive
For 12 months.
until the successful completion of the probation period?
It'll just be the 12.
Yep.
Everybody just nod and smile. Uh-oh. Here she comes.
Board members, I'm just going to remind you that the court report is trying to transcribe your deliberations and your discussions. So just be mindful that you're not all speaking at the same time, if you can.
Slow down, Alex. Here, no, I can hear. Let me have the one that you have already. We can work on it. Suspend, and then what about, but not followed by any probation?
Yeah.
Is everybody okay with that? So we will suspend the APRN license for 12 months, and it will not be followed by any probation. It'll be reinstated, assuming successful completion of the probation period on her RN license. Okay. Let's see.
Yeah, she's a reapply. You might not even do that.
No, ma'am, I got it. Thank you, though. Not pretty, but. Substance abuse disorder, is that the name of the course? Bundle. Substance
The
abuse
nurse and
bundle.
yeah.
And then nurse and professional behaviors?
Yes, Arkansas Substance Abuse Bundle and Nurse and Professional Behaviors.
Okay, we do have a motion before the board. I'm just gonna go through it briefly. You guys pay attention. Okay, due to the violations, the respondent's RN license will be placed on probation for 1 year. And the respondent's APRN license will be suspended and then reactivated upon successful completion of the probationary period on her RN license. Civil penalty for 1 year of monitoring, $750, substance abuse bundle, nurse professional behaviors, counseling, as recommended by current provider. Reinstatement without an appearance before the board with no revisions or changes to the standard stipulations. All in favor? Excuse me, I need a second.
Second.
Thank you. All in favor? Any opposed? And there are abstentions? The board is now out of deliberations. Let the record reflect that it is July 8th, 2026, 2:14 p.m., and the respondent is present in the boardroom. We do have a motion before the board based on the evidence and the allegations contained in the order and notice of hearing. Arkansas State Board of Nursing finds that Kennedy Taylor Holt James, APRN license number 226501 and RN license number R106042, has violated ACA 1787-309A6, and as such, the respondent's license and privilege to practice as a nurse, as a registered nurse, will be placed on probation for 1 year, and the respondent's APRN license and privilege to practice will be suspended for 1 year and reactivated upon successful completion of the probationary period. There's a civil penalty of $750. There are 2 courses that are assigned. The respondent is going to obtain or continue any counseling as recommended and prescribed by her current providers. And the respondent can request reinstatement through the ASBM portal without an appearance before the board. And there are no changes or revisions to the drug-related probation standard stipulations. Signed by Ally Barker and seconded by Tabitha Lancaster. All in favor? Any opposed? And there are no abstentions. The motion will carry. With that, I'm going to turn it over to our hearing officer for a little bit of extra information.
Additional. All right, I'm going to go ahead and mark as Exhibit 6 the board's deliberation document and motion document that was passed, and move that into evidence. I will ask staff to further reduce this document formally to writing. Provide the respondent a copy of that, along with an information sheet or cover letter that notifies her of her appeal rights. Ms. James, under the law, you've got 30 days to appeal this decision, if you so desire, to Pulaski County Circuit Court. I don't know where you reside. Do you reside in Pulaski County? Okay. So that's where you're going to have to appeal it under the law, and you get 30 days in order to do that. And you appeal that again to circuit court if you so desire. If you have any questions about it, we're going to go ahead and make a copy of this and get you a copy of it. Now, granted, this is a preliminary document. They'll provide you with one that's a little more formal down the road. But if you've got any questions at all about what just took place, what the board's decision is, please get with staff and they'll clarify it for you, okay? Any further questions or comments from the board on this matter? Ms. James, do you have any questions at this stage or at this juncture? All right. Well, with that, I'll go ahead and call this hearing to a close. All right, we're off the record.
Good luck. All right, then. He cleaned it up.
Wrong one?
Yeah.
Get a clean one.
Oh, okay.
I just rewrote basically what Ally and them did on.
Oh, that's good.
Just
Okay.
rewrote what Ally and them said on
Okay.
this for her.
Just gonna go ahead and do that.
If you need a second.
Alexandria?
If it matters, but.
Alexandria? I need a break.
Yes, 5 minutes. 5-minute recess, please.
We sure do take long 5-minute break.
Good afternoon. The Board of Nursing is now back in session, and I'm going to turn it over to our hearing officer to start the next case.
Thank you, Madam President. Last item for this afternoon. Styled before the Arkansas State Board of Nursing in the matter of Stacy Lemire Allison Stevenson Hinkle, NCSPN ID 207-23519, LPN license number L059113. The time is just past 12:30 in the afternoon of Wednesday, July 8th, 2026. We are here in the offices of the Arkansas State Board of Nursing located at 1123 South University, Suite 312, Little Rock, Arkansas. Mr. Dawson, would you please identify yourself for the record?
Sorry, can you say that one more time?
David Dawson, representing board staff.
All right, thank you, Mr. Dawson. I will note for the record in terms of the date and the time that the respondent is not present in the boardroom of the Arkansas State Board of Nursing at the address already previously listed. I will note for the record as well that this is set for Wednesday, July 8th, 2026 at 1 p.m. Again, for the record, the respondent is not present. I'll go ahead and take judicial notice of the statutes and the rules that are governing this hearing. And it looks like, Mr. Dawson, you got 7 exhibits. Is that correct, sir?
Yes.
All right, move the admission of those exhibits.
Yes, I move the
All right.
exhibits 1 through 7. Yes.
Thank you, sir. Do you want to go through them for the benefit of the board, or you just want to move forward past that?
I'll move forward.
All right. Those exhibits are made part of the record. I will note that Exhibit 4 lists the Postal Service reports regarding service of the initial hearing notice letter and the notice left for order and notice of hearing. And you might need to lay a little foundation, given the fact that the respondent is not, in terms of staff's attempts to provide service to the respondent, just for the record. You want to do an opening, Mr. Dawson?
No, I'll waive opening.
All right. It appears you got 2 witnesses. Is that correct?
Yes, sir.
All right, ladies. Do you swear or affirm the testimony you're about to give in this hearing is going to be the truth, the whole truth, and nothing but the truth?
I do.
Thank you both. Mr. Dawson.
Thank you. I call as first witness Investigator Melissa Rusenberger.
Melissa Rusenberger, RN Pharmacy Services, Arkansas Department of Health.
Ms. Rusenberger, as part of your duties, do you conduct investigations when complaints are made to the Board of Nursing?
Yes, sir, I do.
And were you given an assignment to investigate a complaint in this matter?
Yes, I was.
And the respondent's name is Stacy Hinkle?
Correct.
Is that correct? And after receiving that assignment, did you conduct an investigation and gather information and produce a report that outlines the findings of your investigation?
I did.
And I believe that's been entered into evidence already. As exhibit number 5, did you have a drug screen report also that you provided separate from that investigation report?
I did.
And that's exhibit number 6. What was the cost of your investigation?
$550.
Okay. So if we would, on your investigative report, which is the thicker one, we'll go through that. First of all, start out and explain, what did the complaint state?
This investigation was prompted by a complaint from Amy Parmenter, Assistant Administrator, Methodist Village Senior Living, Fort Smith, Arkansas. The complaint dated August 7th, 2023 indicates in part, while working at Methodist Village Senior Living, respondent tested positive for methamphetamine, ecstasy, and MET. Facility investigation was prompted when hydromorphone 5 milligrams per mil oral solution was found to be 4 cc short.
Okay, and I think the next section of your report, next 2 sections, have to do with previous employers. I want to skip that for right now and go down to where your attachment pages 18 through 41. Did you obtain records from Methodist Village Senior Living Center?
I did.
And what did you outline here that those records indicate?
On July 10th, 2023, respondent was hired. On August 3rd, 2023, respondent submitted a random urine drug screen following a narcotic discrepancy at the facility. Preliminary drug result form received from facility indicates respondent had a positive test result in part for methamphetamine and ecstasy. Documentation indicates specimen was not sent to the lab for GCMS confirmation, and on August 7th, 2023, respondent was terminated for did not pass drug screen. Employee did not come to facility to talk about drug screen and did not receive termination papers, not eligible for rehire.
Okay, did you review some records also from some patient records from Methodist Village?
I did.
And what was the summary of your findings after that review?
5 medical records were reviewed. 3 were found to have discrepancies. The dates ranged from July 20th, 2023 to July 26th, 2023. A total of 5 milligrams of hydrocodone is unaccounted for, and a total of 30 milligrams of oxycodone is unaccounted for.
Now, did you also review some records from previous employers that I mentioned earlier?
I did.
And just to kind of summarize, did those records reveal a history of respondent failing to show and failing to call in for duty and walking out during their shift?
They did.
Now, did you also obtain a urine drug screen from respondent as part of your investigation?
I did.
And that's summarized in the urine drug screen report.
Yes, sir.
If you would, just read the narrative of that to explain what the results of that was.
On July 1st, 2025, at approximately 1100, this investigator spoke with the respondent via telephone call. Respondent was instructed to report to Mercy Clinic, Fort Smith, Arkansas, within 48 hours to submit to an observed urine drug screen. Respondent's email was verified and Q-Passport was emailed to respondent. Respondent was instructed to present the confirmation Q-Passport and a photo ID upon arrival to the facility. On July 3rd, 2025, at approximately 09:06, according to the forensic drug testing custody and control form, respondent submitted to an observed urine drug screen. On July 23rd, 2025, Quest Diagnostics emailed respondent's lab report to ADH Pharmacy Services. According to the lab report, respondent had a positive test result for methamphetamine at 1,241 nanograms per milliliter. Methamphetamine DNL 8408N panel was then completed, which indicates D-methamphetamine at 99% and L-methamphetamine at 1%. A copy of this report is included in this attachment. Respondent indicated to this investigator via email she has prescriptions for albuterol, gabapentin, and levothyroxine at Walmart Pharmacy in Fort Smith. This investigator attempted to reach out to respondent multiple times via telephone call to discuss the results of the urine drug screen, but was unsuccessful.
On the isomer testing, the D-methamphetamine was 99%?
That's correct.
And is that the D-methamphetamine, the street drug and not a prescription drug?
Correct.
Okay. Thank you. That's all the questions I have.
Thank you, Mr. Dawson. Board members, any questions? All right, Mr. Dawson, your next witness, please.
Thank you. I call Lisa Wooten.
Lisa Wooten, Assistant Director, Arkansas State Board of Nursing.
Would you please start out by going through the respondent's license history?
Yes. Stacy Lemire Allison Stevenson Hinkle graduated on June the 29th, 2006 from Indian Capital Technology Center in Sallisaw, Oklahoma with her PN certificate. She's been issued Arkansas LPN Single State License L059113 by endorsement on July 28, 2017, and it expired on January 20th, 2026. She's also been issued Oklahoma PN Single State License L053086, issued by exam on August 25th, 2006, and the expiration date of that is unknown. It's not listed in nurses. She has no previous discipline, and there's no other license or disciplinary history reported in nurses.
Thank you. Was an order and notice of today, well, first of all, before the order and notice, did the board send a letter out about approximately 6 weeks before the hearing by certified mail through the nurse portal and regular mail to inform the respondent of the hearing date?
Yes, the initial hearing letter, she viewed that through the portal on May 28th, 2026 and June 1st, 2026. The one sent by regular mail has not been returned, and the one sent by certified, has not been returned, signed, and the one by certified mail was returned on 6/8/26, attempted, not known.
And about 3 weeks before order and notice was sent, the same way, would you tell us whether that was delivered?
The order and notice was viewed in the portal on June 21st, 2026. It is out for delivery. And then it also says on here, according to the U.S. Postal Service, on 6/23/26, addressee unknown for the certified mail. The regular mail has not been returned.
Thank you. Did you produce a short report to outline the staff's attempt to communicate with respondent about this matter during the investigation?
I did. It's dated June 10th, 2026.
All right. I think the most relevant portion is what you have in here with regard to requesting an evaluation. I think that's corresponds with your attachments 1 through 10 and 11 through 14. Would you read those two paragraphs, please?
Sure. Attachments 1 through 10, on August 13th, 2025, ASBN staff sent a letter via the ASBN nurse portal and the USPS certified mail to respondent's last known mailing address on file with the board, requesting respondent to obtain a psychological addiction evaluation by November 13th, 2025. The certified letter was delivered on October 18th, 2025. Respondent viewed the message sent through the portal on October 14th, 2025 at 7:39 p.m. and January 18th, 2026 at 9:36 a.m. If you will refer to attachments 11 through 14, on January 14th, 2025, respondent failed to provide the requested evaluation, and ASBN staff sent a letter via the ASBN nurse portal and USPS certified mail to respondent's last known mailing address on file with the board, notifying respondent her case was being forwarded for hearing. The certified letter was delivered on January 20th, 2026, and she viewed the message sent through the portal on January 14th, 2026 at 1:49 p.m. and January 18th at 9:37 a.m. And as of the date of this report, respondent has failed to contact ASBN staff or provide the requested evaluation. And that concludes the report.
Okay. And since the two notices were provided that she viewed in the nurse portal, has respondent tried to contact board staff?
No.
Thank you. That's all the questions I have.
Thank you, Mr. Dawson. Board members, any questions? Hi, Mr. Dawson. Do you rest?
Yes.
All right. How about a closing statement then?
I'll waive the closing.
All right. With that, I'll call the evidence and the testimony in this hearing to a close. I will turn it over to the president and the board for deliberations, motion, and a vote. Madam President.
The board is now in deliberations. Any questions or further discussion needed on timeline, findings of fact? Do I hear a motion? Okay, did we decide that there is a?
There is a checkbox.
Okay, yes.
Me do it?
Yes, please, if you don't mind.
It's that one. It's just a checkbox at the top.
Be suspended until.
Yeah.
Yep, there you go.
You want it?
You need one? I think it's already on there. It like complies with something, something, something. Did you like how official that was? There is a motion before the board that due to the violation, the respondent's license be suspended until the respondent provides board staff with an evaluation that states the respondent is safe to practice. And then at that point in time, if board staff recommend probation after review of the evaluation and the board's investigation, the respondent's license will remain suspended until the board ratifies a consent agreement or until the respondent appears before the board after the evaluation is received. Signed by Tabitha Lancaster and seconded by Katie Rougeau. All in favor? Aye. Any opposed? And there are no abstentions. The board is out of deliberations. Let the record reflect it is 2:47 p.m. on July 8th, 2026. The respondent is still not present in the boardroom. There is a motion before the board. Stacy Lamore, Allison Stevenson Hinkle, LPN license number L059113. Due to the violations of ACA 1787-309A4 and A6, the respondent's license be suspended until the respondent complies with any directives from board staff. Signed by Tabitha Lancaster and seconded by Caitlin Rougeau. All in favor? Any opposed? The motion will carry. The respondent does have 30 days to appeal this decision in Pulaski County Court or in the Arkansas County in which she resides or does business. And there will, of course, be board staff available to answer any and all questions that the respondent might have. And this will conclude. There, oh, I was so close. Mr. Moulton's going to get us ready to conclude.
Ever so close. I'm going to ask, first, we're going to go ahead and mark as, what number is it, Director? 8. All right, we're going to mark as exhibit number 8, the board's deliberation document and memorialization of their decision, and move that into evidence. And I will ask staff to reduce this decision further and formally into writing. Please make certain the respondent gets a copy of the decision, and of course, make every effort that you can to get her a copy of it, along with a copy, cover letter information sheet that notifies her of her appeal rights. The president has covered everything else. So with that, I'll call this hearing to a close. We're off the record.
Do we have any business to handle right now? Okay. Great. We will recess until 8:30 a.m. tomorrow. See everybody then. Thanks, guys.